So my name is Anna Kegistin. I'm a doctoral student, and I'm currently sitting in Addis Ababa, where the International Family Planning Conference is ongoing. We have about 300 youth delegates from all over the world taking part in this conference. And I've been taking the lead on all the youth activities going on, and we have been able to sort of arrange a training for them. So they're meeting now for 2 days to prepare themselves for taking an active role during the conference. So it's really exciting, and I'm looking forward to see what they're up to during this week. So I've been at the School of Public Health for about 2.5 years now. I came in as a master's student and transitioned into a doctorate. And what's really cool about this place is all the opportunities that arise. You can just walk down the hallway and sort of interact with both peers and professors. And you really need to sort of be in the moment and take opportunities as they come around. And it was really my relationship with my advisor and working with him that sort of resulted in the opportunity to work on this conference and to take the lead on all the youth activities. And it's been great because I've done that a lot in the past in Europe, but never in the international context. And it's really why I came to Hopkins. So in addition to the research component, it's been a fantastic opportunity for me. And I think Hopkins is one of the few places where that's really possible.
My name is Leslie Vink. I'm the Director of Recruitment and Communications for the Student Affairs Office here at the Bloomberg School. And on behalf of admissions and the Student Affairs Office as a whole, I wanted to, first of all, congratulate you on being admitted and also welcome you to the Johns Hopkins Bloomberg School of Public Health. I'm actually speaking today on behalf of our Associate Dean for Student Affairs, Michael Ward, who unfortunately was hit with a bad case of the flu this week and has been out all week. So he definitely sends his well wishes to all of you and his congratulations. But personally, in the spirit of public health, I'm kind of glad he chose to stay home. So, but before I go any further, I wanted to get kind of a poll of everybody who's here today. Obviously, you're all admits, yay! But who has definitely accepted the offer and knows that Hopkins is where they're going to be? Okay. So, Stephen, we have our work cut out for us today. Okay. How many of you, is this your first time to Baltimore? Okay, great. Well, welcome. So today is all about getting your feet wet here at the Bloomberg School, and we want you to really just get a taste of what we're all about as far as our academics and our student life and getting to know the resources that are available to you. You're going to hear from Dean Gange in just a minute, as well as other faculty, and you'll have the chance to talk with a lot of our current students. Some of you have been escorted up to Feinstone Hall by some, and they may have been chatting with you at breakfast, but they're going to be accompanying our tours and just throughout the day. So we want you to get all of your questions answered. This is the goal of the day. So please take advantage of all the folks that you're interacting with today. You're going to have the opportunity to check out a lecture, which I'll talk about in just a minute, and really truly learn the ins and outs of your department or your program. The afternoon, we have departmental lunch sessions where you're going to spend a few hours with your specific departmental program that you've been admitted to, where you'll be able to, again, meet with faculty, current student, staff, the whole bit. So we really want you to take advantage of that. You're also going to be able to hear about resources and services that are available to you as a student here. We have an afternoon information fair where you'll be able to meet with a few of our student support offices. And of course, we have our Student Affairs office, which is located in those double glass doors that were right where you picked up your packet. And you're welcome to pop in there until 4 o'clock today if you have any questions. I'm going to just say a little disclaimer. We had a tiny little flood in there yesterday, so it's a bit of a construction zone, but everything's fine. Your materials were dry, so that's all that matters. It doesn't usually look like that, so but we do have staff that are available to assist you throughout the day, and we have our admissions team that is going to be helping you with the campus tours and things like that as well. So we invite you to take a tour of the campus to learn about the building, and also if you are able to, and we really hope we get to see a lot of your faces, we'd love for you to join our afternoon reception where we're going to have a few deans and faculty and staff as well. It's just located out here in the gallery as well. So the objective of today is for you to really understand what we're about and understand the passion that's here. I'm the director of recruitment. I'm not a student, but I walk along these halls and you can just get a sense of the energy. From the students that I talk to, everybody's excited, and it's a great collaborative environment here at Hopkins. And Mike Ward, in his spirit today, he always says, we live and breathe this stuff here, and it truly is the case. It's an exciting place to be, and we're thrilled that you're here to be a part of it. So later on this morning, you're going to have the opportunity to hear from a few of our faculty. I know a lot of you are interested in possibly sitting in on courses while you're here, on classes, and with the size of students that we have coming in for Visitors Days, unfortunately we don't have the capacity to put you all in specific classes, so we're bringing the faculty to you. So we're providing a list here of different presentation topics that you can pick from during our Bloomberg seminar series. You can hear from Dr. Sarah Bleich, from the Department of Health Policy and Management, talking about obesity policy, or hear from Professor Stan Becker from the Department of Population, Family, and Reproductive Health, talking about population dynamics. And then also Susan Sherman from our Department of Epidemiology, who's talking about economic empowerment as HIV prevention. So these are faculty that you have the opportunity to take courses with, so you actually get a real experience of what it's like to hear from our faculty. So we have lots for you to do in 8 hours. And our goal, again, is for you to leave here today with the tools that you need to make your admissions decision and hopefully accept our offer so that you can join us in our mission of protecting health and saving lives millions at a time. So thank you all for coming. I know some of you have come at a great distance, and we're really happy that you're able to be here with us today, and we wish you a great visit. So I'm delighted to get to introduce our next presenter, Dr. Stephen Ganji, our Associate Dean for Academic Affairs. Dean Ganji is a professor in our Department of Epidemiology with affiliations with the Center for AIDS Research, the Center for Global Health, as well as with the Women's Interagency HIV Study. His research interests include epidemiologic and statistical methods for cohort studies, data science, evaluation of therapies and biomarkers and observational studies, epidemiology and pathogenesis of HIV/AIDS, and data management and statistical coordinating centers. Dean Ganji has spent nearly 20 years working primarily in HIV/AIDS with experience in scientific leadership that spans basic, clinical, epidemiological, and policy-level research. He's also worked on studies of HPM, substance abuse, and molecular biomarkers for liver cancer with investigators across the university. While Dean Ganji's accomplishments are quite extensive, one of the most important is that he is the recipient of the Advising, Mentoring, and Teaching Recognition Award from our students. So without further delay, please join me in welcoming Dean Ganji to the podium.
Thank you, Leslie, and welcome. You made it. Right? Congratulations. Admission here is not easy, and it's a pretty competitive place to get in here. So I could just stop here, right? But I want to give you a little bit of experience or information about the school and about public health. I really think, I've been working in public health for over 20 years now, and it's been a really good ride, and it's really a great time to be working in public health. And why is it a good time to be working in public health? First thing is, we work on things that are challenging, right? We work on things here at the school that you might not think of as traditional public health. So this is a slide from a summit that we had after the Newtown shootings in Connecticut, right? In which investigators here, faculty here, who had been working on gun policy for a long period of time, were motivated to do something. And in a period of time of just a couple of months, we're able to put together a huge summit that we had here at the school that was led by three of the investigators in our health policy and management faculty, Jan Vernick and Steve Terrett and Daniel Webster, and they were able to, become motivated to actually do something and put together the evidence for trying to reduce gun violence here in the U.S. They were able to put this book together in 2 months and put a copy on every desk in Congress. So, you guys know the intense outpouring of emotion and concern that was coming out after Newtown shooting. Here's an example of our faculty motivated, doing something, and bringing the evidence together. This was a very high-profile event. People know who this is? Yeah? Who is it? Michael Bloomberg, good. You can't come to this school without knowing this guy, right? This is Michael Bloomberg, who was here and presented one of the keynote addresses. Next to him, people know who this is? Anyone? Ron Daniels. Ron Daniels, president of Johns Hopkins University. And standing next to him, people from Maryland should know this, right? Yeah, Martin O'Malley, the governor of the state, okay? Pretty high-profile event, bring Michael Bloomberg, the governor, and the president of the university here to actually do something, not just have a conference, but to actually pull together experts, put evidence together, and make a difference. Another reason why public health is interesting to work on nowadays, a lot of heightened public interest, right? Some of you might have seen this. This is some work that Dr. Eliseo Guilar, a professor in epidemiology, put out in the end of last year, a couple of months ago, an editorial in Annals of Internal Medicine, again, synthesizing the evidence. Look at this title, right? Enough is enough. Stop wasting money on vitamins and mineral supplements, right? Multi-billion-dollar industry. Editorial, important enough. You know, I was sitting at my desk. You know, I periodically look in CNN to make sure, you know, they haven't cured AIDS or, put me out of a job. And you know, I was shocked to see this breaking news, right? The breaking news is editorial in Annals of Internal Medicine says supplements and multivitamins to prevent chronic diseases is a waste of money, right? This is an example of good public health going on here at the school, right? We have really dedicated people in public health. One of them who's standing over there, Dr. Tom Burke, professor in health policy and management, associate dean for practice, has been nominated by President Obama for a high-level position at the EPA. Here he is at his Senate confirmation hearing a couple of weeks ago. Right? We have dedicated people all over the world. Tons of faculty here. I'll talk about them in a little bit more detail. These are two pictures from trips that I've taken just in the last year. We have a cooperative program in Jaipur, India. This is Dr. Marie Diener West, head of the M.P.H program, and I with the faculty in that program. This was just taken a couple of weeks ago. We have a program run in South America teaching epidemiology in Spanish. And these are faculty, including Bob Lawrence, the head of the Center for Livable Future here, David Celentano, the department chair for epidemiology, and other professors here. Right? Really dedicated faculty. These are not programs that are making us tons of money. Right? These are programs that are out there illustrating our commitment to public health and to public health education. Jobs, right? Jobs is another good reason to be in public health. Right? According to Department of Labor, occupations that are expected to see job growth over the next 10 years. Epidemiologists is expected to grow 10%. Environmental health specialists, 15%. Health educators and community workers, 21%. Right? People want to hire the people we're training. Right? And I think that I didn't put a list here, but if you look at the list of jobs that our students have when they're leaving here, it's an incredible range of opportunities. And then lastly, not to be forgotten, is we can make a difference. Right? We can improve people's health. Right? This comes from a couple of years ago. Time magazine rated one of the top 10 medical breakthroughs is that male circumcision can prevent HIV. This was a study based on a set of clinical trials that came out that were led by Dr. Ron Gray, Maria Waver, and Tom Quinn, building upon epidemiologic evidence to illustrate that this procedure actually works at cutting the incidence of an acquisition of HIV by 50%. Right? The vaccine people would give their left eye tooth for a vaccine that had anything close to a 50% efficacy. Right? And here, based on good epidemiologic research, they were able to come up with a renowned clinical trial and demonstrate this works. And now this procedure is being taken up across Africa. So, you know, all of these reasons are why a great time to be in public health and illustrate, our tagline, right? Protecting health, saving lives, millions at a time. So, based on this, really incredible opportunity out there to make a difference, what are the opportunities here at the School of Public Health? So I want to talk a little bit about history. I'm not going to bore you too much with too much because I could give a whole class on this, but I also want to talk about where we are today. So how many of you know the Johns Hopkins story? Right? The story of Johns Hopkins. Johns Hopkins was a new university that was founded in 1896. Right? This was a model that was different from any other university here in the United States. It was a research-oriented model that was trying to pick out the best from Europe on using evidence for making a difference, in this case for education, and shortly after the university was established, the medical school was established, and it was a way of integrating research and evidence into medicine. A couple of years later, based on a Rockefeller grant, the School of Public Health was founded in 1916, so we're coming up to our 100th anniversary. A number of schools across the U.S. talk about how they are the first school of public health. There are many programs that were established, but in terms of the actual first continuously operating school of public health, we are the first school of public health, right? And as I said, we're going to be celebrating our 100th anniversary in a couple years. This was a new model, right? The establishment of the school brought this idea of integrating research together with practice and training into one organization. The school started out as the School of Hygiene and Public Health, right? Bringing this, a European idea of hygiene, which was certainly emerging in the early 20th century. In 2002, we adopted a new name, partly in response to a very generous gift by Michael Bloomberg, and we renamed the school the Bloomberg School of Public Health, right? Throughout all of this time, the school has had, even back to 1916, an international scope and focus on all of the components of that are important for public health, for education, for research, and for mentorship. So the original building for the school was back in 1920s, right? So that part of the building over there is the old original part of the school, and it has expanded a lot. Obviously, it didn't look like this back in 1916 or 1926, right? So here's a picture from the 1960s, and you know what it looks like today, right? We're continuing to expand, make sure that we have cutting-edge laboratories. The laboratories in this part of the building were just renovated over the last couple of years. They are now state-of-the-art. We're building a new building a couple of blocks away for a number of research studies as well. And we have, I didn't even show all the kind of international places as well that we are at. School of Public Health has really, excuse me, been filled with people who are trailblazers in public health, right? Here's just a couple of listing of some of them. Abel Warman, and studying the impact of chlorinated water, right? Evie McCullum, whose portrait is actually right outside of this room, discovered vitamin D and saw it as a method for preventing rickets. Rachel Carson was here, right? Many of you know and have heard of Rachel Carson, who inspired the environmental movement. Abe Lilienfeld and George Comstock really helped establish the whole area of chronic disease epidemiology, right? As epidemiology itself transitioned away from infectious diseases and trying to understand chronic diseases, understand the causes of coronary heart disease or cancer, takes a different set of tools and techniques than those to study the effects of cholera or malaria. Al Summer is well known for uncovering the power of vitamin A in his international work for prevention of blindness. Kirti Shah was instrumental for linking HPV as the actual cause of cervical cancer. These are the kind of projects that have been done in these walls. We have tremendous students. We have tremendous alumni. Here's just a listing of where some of our graduates have gone, right? We've led to, over 3 directors of PAHO, 2 U.S. Surgeon Generals, 2 recipients, the U.S. President Medal Freedom, health ministers in a number of countries, directors of the Office of National AIDS Policy, World Health Organization, USAID Malaria Control Program, presidents of major societies, and others who have become deans of the School of Public Health. So let me talk briefly about, I'm not going to go through all of the deans here at the School of Public Health. D.A. Henderson was the 8th dean. This is a picture that was actually taken last year in this room, in which we had a portrait unveiling for D.A. And this portrait is sitting outside of my office, actually, on the other side of the building. D.A. was instrumental for reducing smallpox. He was leading the smallpox eradication effort. And all of this is captured in a really great book that he's written, talking about all of the trials and tribulations of eliminating smallpox. DA was followed by Al Summer, the 9th Dean of School of Public Health between 1990 and 2005. This is a picture of him from last year with Bill and Melinda Gates. So Al Summer is a former recipient of the Lasker Award and chair of the Lasker Committee, and here he was at the presentation of the Lasker Awards with Bill and Melinda Gates. Again, Al had a tremendous career, tremendous impact in public health. Has written a very nice book. Actually, this book, for any of you who are M.P.H students, this book is actually going to be highlighted over the summer. It's not too long, but again, it talks about all the lessons that Al learned in public health over his career. Our current dean is Michael Clagg. Dr. Clagg has been dean since 2005. He is a nephrologist. He was vice dean of the Department of Medicine over at the School of Medicine, and is tremendously well known for his work in kidney disease epidemiology. And this is a picture I took of him in Shanghai last year giving a talk. Right. So, all of these, people are very accomplished individuals, very committed to students, very committed to the school. Our mission here, we are really a mission-driven institution, even more so than any other division, I think, here at the university. Right? When I talk with friends up at the Arts and Sciences campus or with provosts or others, all of them say they cannot believe how cohesive and empowered the faculty, the students, and the staff are around a particular mission. And this is our mission as we've described it. The school is dedicated to the education of a diverse global community of research scholars and public health professionals, and to the discovery, dissemination, and translation of knowledge to improve public health. Right? This is all encapsulated in our tagline again, protecting health, saving lives millions at a time. Where are we today? Right? So let me talk just about a few things about where we are today. First, let me talk about students. This is a picture of Dean Clagg and I with a number of fellowship students. Our school is big. Our school is the biggest school of public health in terms of a lot of different metrics. One of them is student numbers. So this is a graph over the course of time from 1919 through 2013 of the number of students enrolled in the school. Right? And you see that it's in excess of 2,200 students. Right? Dramatic increase over time. We have, these are split out by M.P.H students, which are overall the full-time program is about 230 students. Part-time program, a little bit more than that. Other master's students in different departments, number about equally. The same number of M.P.H students, number of doctoral students are listed here. Our number of doctoral students is bigger than some whole schools of public health. In fact, most schools of public health. And then we also have non-degree students here. Again, topping up over 2,000 students. We attract students worldwide. The international students are displayed here, so it's about 28% of our full-time students, 24% of our part-time students. The top 10 countries where students come from are listed here. Right? Of the U.S. students, 16% of them are underrepresented minorities, something that we are committed to enhancing. What about our faculty? This picture, again, was actually taken here. This is a faculty member, Bill Moss, a professor in epidemiology, and this is the back of Al Summers' head, actually, because I was sitting behind him. Right? Our faculty are tremendous. We have over 600 full-time faculty, over 700 part-time faculty, and these are not part-time faculty who just have appointments and put on their CVs. These are people who are active here at the school. They are capstone advisors. They teach in our classes. They sit in our committees. They bring industry or public health practice into our school, and we're very happy to have them. I couldn't even go over the number of peer-reviewed publications, influential publications that our faculty put together. It's hundreds per year. There are over 300 people who sit in other divisions of the school, of the university, whether it's medicine or nursing or arts and sciences, who have joint appointments with our school. And on average, there's one full-time faculty, professorial faculty for every 2.7 master's students and 2.3 doctoral students. Again, something that I think we are very proud of. Our faculty are of the highest quality. It is not easy to get appointed here. It is not easy to get promoted here. These are just two of our most recently announced Bloomberg Distinguished Professors. This is Peter Augury, who received the Nobel Prize in 2003. Peter is a faculty member of MMI with a joint appointment in the School of Medicine and runs the Johns Hopkins Malaria Research Institute. And this is Catherine Eden, who is a professor in population, family, reproductive health, and also has a joint appointment with Arts and Sciences Sociology. And she studies poverty in inner cities, right? Two tremendous faculty members. Many of you might have heard about the tremendous gift that Mike Bloomberg gave to the school for recently. A lot of that gift was actually reserved for faculty members and recruiting high-quality faculty members. And so only 3 have been announced to date. We have 2 of the 3 who are located here in the school. Again, I think that reflects the quality of our faculty as well as the quality of us here at the institution. We are all over the place, right? We are in every country, every continent, not every country. This is just a listing of project sites, and you go to the website to actually see where those sites are actually located. We have faculty who have interests that span the globe. So I'm not going to talk too much about all of the academic aspects because you're going to be hearing a lot about that from the individual departments. I think most of you should know that we have 10 academic departments here at the school. We have over 500 courses. I couldn't even begin to summarize those for you. You'll hear a lot about that later on. We have more than 70 centers and institutes. These are typically centers that may sit within a particular department, but their faculty and their interests typically cross either a department or a school, right? So we have centers for autism, centers for AIDS research, centers for vaccine safety, centers for gun policy and research. These provide a lot of the opportunities for students with particular interests. We have a lot of degree offerings. Again, I'm not going to go into all the detail of that other than to point out we have both research-oriented degrees, that's where our Ph.D. and SDD degrees are, that emphasize the discovery of new knowledge, with practice-oriented degrees such as the Doctor of Public Health. We have also similar master's programs, right? We have research-oriented master's programs that are here to advance study and research skills, as well as practice-oriented and professional programs. And of course, we have the M.P.H. program, which is a unique program here in being full-time for only 11 months, 80-term credits. It's a school-wide program. It's not departmentally based. It really is a program that is flexible and allows you to customize and concentrate in many different areas. We also have a number of combined programs. So one unique aspect for those of you who may be doctoral students, we have concurrent degrees that you can actually get. So if you're a doctoral student in epidemiology or in environmental health sciences and you want to get a master's degree in biostatistics at the same time, you can do that. Or get a master's degree in international health, you can do that. And we also have over 20 different certificate programs that also offer particular specialized training. The way that we teach here, I think, is cutting edge. Right? We are using what I would like to think 21st century pedagogy for that's leveraging both good strategies for teaching. We've always had active learning as part of our blood. This is a picture actually from an epi lab back in the 1960s, right? The epi labs don't look like this anymore. We don't have wooden chairs, and it's not just filled with white men anymore, right? And you don't have to wear a suit here, right? But we've always had active learning. We've always had, the idea that public health is not sitting in a lecture and receiving information. It's doing stuff. And we have more and more leveraging of our online platform that I'll talk about in a second with flipped classrooms and blended classrooms. And you're going to see more and more of that when you come here. Students have an opportunity to actually participate in this. You have an opportunity to learn how to teach. Right? We have students who are participating in the Preparing Future Faculty program, which actually is a formal program that teaches you how to teach. We have a fellowship program with Arts and Sciences that allows you to actually put a course together up at the Arts and Sciences and teach it. Right? So one of my own doctoral students is doing this right now, and he's having a blast with teaching undergraduates HIV epidemiology. Right? Our school has been really a leader in online education. We started working on this not last year, but back in 1997 when we recognized the power of online learning. And this is a plot that just shows the number of courses that are online that stopped at 2012. We actually have over 130 courses now that are online. Our courses are integrated with our program. They are high quality. They offer a degree of flexibility so that if you can't fit in a course in person, you may be able to take it online. There's a lot of diversity on there. Unlike a lot of schools, we don't have a separate online program. People who are doing online classes could be people you're sitting next to, or they could be people in Bangladesh. Right? They are completely integrated with our current program. And if you actually look at the percentage of students who actually take more than one online program during their degree, over almost a third of our students are taking an online class. And it certainly depends. If you're a doctoral student, you're slightly less likely. If you're a master's student, you're slightly more likely to actually take an online class. Our school has really been also at the forefront of massive online open courses, or MOOCs. Right? This is a picture of the co-founder of Coursera, Daphne Koller, when she came to meet with us a couple of months ago. Our school has really put this, embraced this space, and the reason for mentioning it here is not for you not to come to Johns Hopkins and say, well, I can get everything on Coursera for free, right? But it's really to, I think, illustrate our commitment to education, right? We are committed as part of our mission to ensure public health education. And part of what we do is take the material that we offer here in class and put it online and make it available broadly to the world. It isn't everything that you're learning here. It is not the same experience, but it helps, I think it is part of our mission to engage in this space. And if you look at what we've done, we've been really successful. Right? This is updated a couple of weeks ago, showing the number of people who are enrolled for our Coursera courses. Up to the end of February, it was 919,000 people. Right? We are almost crossing 1 million people who have signed up for our Coursera courses. So I think this is, again, reflecting our interest in education and interest in engaging with the world. So lastly, but not least, practice and service. Our faculty are all over the world, are engaging in places here in inner city Baltimore, as well as the slums of India, or every place in between. Our faculty are engaged, they are in service, they are working with local, national, and international partners in a lot of different opportunities. And students have a huge opportunity to partner with faculty and work on some of these experiences. And you're going to be hearing more about this and source and other things later on today. So if that didn't convince you, right, about the school, right, Baltimore should, right? Baltimore is a great place to live, right? I'm not going to take a poll of how many of you have watched The Wire, right? The Wire's not right, right? The Wire doesn't capture what a great city this place is, right? Great city life. There's great recreation. There are great arts opportunities here. We are close to the bay, if you want to get out for the 2 days that we let you out every year. Baltimore really is a great city. I've lived here for over 10 years. And if that hasn't convinced you, right, I'm obligated to present this, right? I'm not going to dwell on this, right? But this is a culmination, right? This is a culmination of all the stuff that I talked about before. The faculty, the students, the opportunities, the tools that you're going to get by being here. This is what's contributing to us being number one, right? It is not a vanity thing. It is reflective of what I think is a really great program. And with that, I'm going to stop. I really invite you to join us here. It is a great institution. I'm over time, but I will be here at the break if you want to ask me any questions. So thank you very much.
Thank you, Dean Gange. So I'm excited to get to introduce our next presenter. It's one of our own, Dr. Ruthie Fezihazian, an alumnus of the Bloomberg School and former recipient of the prestigious Hopkins Sommer Scholarship Program. A first-generation daughter of Eritrean refugees who grew up along the U.S.-Mexican border, Ruthie became aware of health inequities that exist because of factors beyond our control. When she began to study public health at the University of Arizona, where she studied community health education, she analyzed how immigration policies affected the health of migrant farm workers. Ruthie then came to the Bloomberg School. It might be my cell phone. It's my fault. I'm supposed to tell you not to turn off your phones too, by the way. Sorry. Ruthie then came to the Bloomberg School in order to focus more on the social determinants of health and health disparities. She earned her Ph.D. in health policy and management in 2012. After graduation, Ruthie began working for the Baltimore City Health Department as a health policies and programs administrator, where she helped city agencies implement health policies and initiatives throughout the city. Currently, Ruthie is working as a program consultant at Care First Blue Cross Blue Shield patient-centered medical home, where her job is to work with primary care practices across the state of Maryland to achieve quality improvement and cost savings for their patients. Ruthie's dedication and passion for the field of public health are truly inspiring, and we're so happy that she's here to speak with you today. Please join me in welcoming Ruthie to the podium.
Hi, everybody. So something to know about me. Despite how many times I have to speak in public for all my jobs and all the different things I've done, I always get really, really nervous when I have to talk about myself. And so when I get nervous, I tend to say something really silly or something really stupid about me. And I had to make sure to ask that in case I do say something silly, that they promise that they won't take my degree off my wall in my house. Okay. So it's really a great pleasure to be here today. I had a great time at Hopkins, which is probably why they asked me to be here. And because they promised they won't take my degree, I can be completely honest with you about why I chose to come here and some of the things that you probably want to consider before making this big step. And so it was actually a really great exercise to reflect back on my time at Hopkins and actually consider why is it that, I guess 6 years ago, I decided to come here. And I think sometimes in our life, a lot of things happen pretty randomly. I know I thought I got into Hopkins pretty randomly, but I think when you reflect, you start to see, oh, there was actually a method to this madness, that there was nothing actually really random about it. And so I think, as Leslie said, I started off in Tucson, Arizona. Anybody out there from Arizona? No? Anybody who has the University of Arizona going to the Final Four in the tournament? My new best friends. I love you guys. Awesome. Tucson, great place to be, 350 days of sunshine. Definitely a fun place. And I studied community health education out there. I was all about grassroots efforts, definitely very community-based, trying to implement public health change at the community level. And one day I got really excited about social justice and ended up joining this research project where I had to research the health status of migrant farm workers down by the US-Mexico border, a lot of whom who are undocumented. And I went out there to visit one of our community partners, and he decided to take us down to the border to actually see, the big wall that divides the United States and Mexico. And literally, I'm like, from where I am to the podium, maybe to the back of this room, like that's how far the wall is. And I'm staring at this wall, and the guy is telling me a bunch of the stuff, and all of a sudden, I see a person like peek over the top of the fence and then literally jump over and run as fast as he can into the United States. And of course, it's like very shocking. You're like, what the heck is going on? And I'm hoping like he comes and nobody like stops him. But of course, 10 seconds later, Border Patrol truck comes and stops him, arrests him, puts him in the truck, and takes him away. And so I asked our community partner, I was like, what's going to happen to this guy? And he said, he's probably going to be arrested, spend a couple days in jail, be fined, and then eventually just taken back over the border. And at that point, I had this whole epiphany. I was like, here I am trying to study, the downstream impact of, all this stuff going on when we're talking about an upstream problem, and I have no idea how to solve this, and I need to go get a Ph.D. in health policy. That was it. That was pretty much my making process of how to pursue a Ph.D. And so the one problem was that I was a junior in college, not much work experience, very little research experience, but I knew I wanted to get a PhD. And so I applied a very lot of schools. Actually ended up having to call every single school of public health and ask them if they would accept an undergrad and straight into a PhD. Only 2 at the time would do it. Hopkins turned out to be one of them. And one day I get a phone call from the guy who's hiding over there in the hoodie, who's the associate dean for public health practice, who, he told me that the committee thought I had a lot of potential, but probably would be a better candidate for the master's program. And so if I would consider doing the master's program. But remember what I told you, when I have to talk about myself, I get really nervous and say very silly things. And so when he asked me, I told him no, and that I wouldn't have applied for the PhD if I didn't think I was ready. And so he went on to say a couple other things, but I was just hitting my head against the wall thinking, why did I say something like this? I should have just said, yes, it's Hopkins. You have to say yes to Hopkins. But, very nice, of course. And I hung up the phone, and I thought I would never hear from them again. A week later, I got a phone call saying that I was accepted into the PhD program. And, of course, you do your happy dance. And then I came to Visitor Day, and I saw the fun videos. I went down to the Inner Harbor, ate some crab, saw Joe Flacco, actually, walking around the Inner Harbor, followed him around like the paparazzi. It's great. And I think what kind of drove my decision to end up coming to Hopkins, there were 3 pretty much main things. First was that they let me into the program that I really wanted to do. Of course, they talk about, thousands of faculty members here. And at the end of the day, you have to have people who are interested in doing what it is you want to do and who want to teach you. And so it was such an amazing match of my interests. I wanted to do social determinants of health, focus on solutions for health disparities. And, not only is there just one person doing that here, who happens to be, the best in their field, of course, because everyone here at Hopkins is the best in their field. It's kind of intimidating sometimes. But not only was there one, but there was actually not hundreds, but, there was tons of them who were all here willing to help me to learn. So number 1 was that it was a match in my interest. Number 2 was that there was people here who actually believed in me. I think it goes to show if somebody sticks their neck out on the line and, advocates for you, whether it's to get a job, to get into school, to get a parking space at the mall. I mean, when somebody does that for you, it means a lot. And to have somebody who really went on my behalf and advocated for me, I feel like that just meant a lot and spoke to the kind of people that are here working for the students and who are advocating on behalf of the students. And I really thought it showed me a lot about the people that I would be interacting with on a day-to-day basis. And I think the third reason I chose to come here was that, surprisingly, nobody was telling me no to any of my questions or any of my suggestions. I wanted to, I wanted to take all these classes, and I wanted to just not do what my program required. I wanted to do all this extra stuff. And my academic advisor, he never said no. He said, let's figure out a way to make that happen. And I think I was a 22-year-old kid who didn't know, had big ideas, wanted to change the world, no idea how to do it. And to have somebody who was just so smart and so encouraging to say, you can do this and you could do it the way you want to do it. I think that just got me even more excited about public health. And so I ended up coming out here and had a great time moving out here. I actually ended up coming 6 weeks before school started because I was really scared that, I wasn't going to know which direction was north or south, and I just wanted to have a sense of direction. And so definitely, I spent 4 years here, and over the course of my time of pursuing my Ph.D., definitely, of course, huge academic accomplishments, definitely a lot of fun. You meet a lot of funny people here, but definitely also very challenging. I think I've never been pushed more intellectually in my life, which is a good thing. I needed that. At that stage in my life, I needed somebody who was going to push me to see how far I could go. And I think when I think back to all the things I did here, of course, as a student, you do take a lot of classes. We're on the quarter system, so you take, a lot of classes. And, the three people who are going to be speaking a little bit later, so Dr. Bleich, Dr. Becker, and Dr. Sherman, I took classes with all of them. They're on, 3 different departments. And so that goes to show you I tend to take a lot of random classes, but it actually worked out in best in the end. So yes, as a student, you take lots of classes. The other thing is, sometimes the school gets a little bit big, but you are put into cohorts of people. Sometimes, for Ph.D., maybe 10 to 15. For master students, and maybe 20. For the M.P.H, you get a cohort of 200 people, which is awesome. And, these are people who are going through the experience with you, which is good. You need somebody to kind of tell you, I'm feeling the exact same thing, but we're going to get through it. And in case you don't like any of those people that they kind of put you with, there are 100 student groups to choose from. So you can go find people who actually have something in common with you besides that you're in the same degree program, which, the student assembly, I was the president of the student assembly, involved with it for 4 years. You all should join it. You all are future presidents of the student assembly in this room because you came to the first visitor day and not the second day. I don't know what I'm going to say to the second day people. But it was actually a really great experience. When I was actually interviewing for research positions when I was on the job market, they actually asked me more questions about my time on the student assembly than they did about any research project that I worked on, which I don't know if that's weird or not. But hey, I had something to talk about besides all my cool research projects. And of course, being at Hopkins, they do tons of research. And so I did lots of research while here. Even as a PhD student, you have to do lots of research. Master students, if you want to, I worked with tons of great master students who I consider them colleagues today. And actually, one of my I did a lot of research on the social determinants of health, which Tom actually ended up introducing me to the Baltimore City Health Department because that was my interest, and they were interested in social determinants of health, which led to an internship, which in turn led to a job, which was fantastic. You got to have a job when you're done with the degree, right? And I actually spent 2 years with the Baltimore City Health Department. I had the fun job of convincing every city agency that they had an important role in health. You can imagine how fun those conversations were. And remember how I told you I took lots of random classes? But this is where it actually came in handy. So literally in 1 week, I would have a meeting with the fire department, then the Baltimore Development Corporation, then the library, then Public Works. And it was so helpful being able to talk about health from all these different perspectives because I had to convince these people that public health is awesome and that you should be doing something more doing something more with it. And so definitely had a lot of fun with research, but I guess I should say, of course, as a PhD student, the one thing that I did do was complete my dissertation. I wrote a brilliant dissertation. It was on the impact of the recession on health and health disparities, really fun stuff. And even now, I'm smiling when I talk about my dissertation. It wasn't that miserable when you complete it. So I think that's important to say. And actually, I do consider it one of my greatest accomplishments that I completed my degree program without getting any gray hairs. And I say that's important because that shows you that I actually did sleep when I was here. I ate kind of healthy. I exercised sometimes. I, made friends and went out sometimes. There is that work-life balance that they always tell you about in the real world, but there's that school-life balance that sometimes you forget about, but it's definitely still very possible when you're here. And so you definitely do a lot of things while here. So I did my time at the health department, and now I'm actually with Care First Blue Cross Blue Shield. It's our regional health insurance plan. I'm going to need another 15 minutes if I'm going to explain to you how I ended up in healthcare, because that's another random story, but not so random actually. And I won't actually tell you that story, but I will tell you this, that it was one of my Hopkins colleagues that did get me the job there. So, be nice to the people in the room with you because they can get you a job one day. And so I guess I say all that to say, when I look back at my time at Hopkins, of course, I felt incredibly intellectually challenged while I was here. That whole idea of you ponder the questions, you're going to dedicate your whole professional career to answering. Of course, you do all of that. And it's fun when some of my classmates, they talk about their time at Hopkins as always their warm and fuzzy feelings, but I'm not such a warm and fuzzy person, so I didn't actually end up feeling that way when I completed my degree. But what I did feel was an immense amount of respect for this place, because I think days where my mind is clear and focused and days where my mind is like all scrambled and I can't think straight, I always come up to the same conclusion about my time at Hopkins. And that is, without even realizing it, I got exactly what I needed from this program to do the kind of work that I need to do and to be the kind of public health professional that I want to be. It kind of took all the deficiencies that I had as, just a young person coming into this program and just kind of filled me up and prepared me to send me off. And I didn't even realize that that's what it had done. And it kind of took sitting down and writing out all these things to actually realize that that's what happened. And so, of course, this is a big decision. I know you're probably kind of exhausted traveling from one university to another, visiting different places. And so I think I remember on my plane back to Tucson after sitting here in admitted student day, of course, me, very logical, I wrote out on the piece of paper what exactly I wanted to get out of my experience. And all of a sudden I realized, Hopkins offers a lot, and it was offering exactly what I wanted, and so it was only logical for me to come here. And so I definitely encourage each one of you to just sit down, and if you think about what it is you really want to get out of a degree program, and if Hopkins is offering it, then I definitely say that it's a great decision to make. And so thank you for letting me chat with you a little bit. I'll be sticking around for a little bit if you want to hear the 15-minute story of how I ended up in insurance, but thank you.
Thank you, Ruthie. Okay, we're ready to break out into our Bloomberg seminar series. You've heard us all mention all the faculty that will be presenting. Just to give you some logistics, Dr. Bleich will be in here in Sheldon Hall. Professor Becker is going to be in Becton Dickinson, which is right across the hallway. We have staff out there to direct you to where it is. And then Dr. Sherman is in Anna Bacher room. When you go out of this room, you're going to make a right, and then you'll go to a T and make a left. Again, there's signs, and there's people to help you get to where you need to be. So those sessions will go until close to 11, and then we'll be starting back in here at 11 o'clock for next sessions. But before you go, everybody's been talking about this guy, Tom. And so I wanted to just quickly show off his little accomplishment that he got. He's our Associate Dean for Public Health Practice and Training and has always been a part of our Admitted Student Visitors Days. But then he went and got appointed by Obama, to go head the EPA. Priorities. So while he's patiently waiting his appointment with the White House, he wanted to stop by because he tends to think that he looks really cool in a Hopkins hoodie. And he wants to make sure that you all get a little head start. Not you all, sorry. Some of you get a head start on this obvious fashion statement. And also, he made us take this picture. This was totally forced. So just this little fun game, if you pick up the desk that's on your chair and look underneath it, if you see a Hopkins logo, you win a hoodie. Where's the cheers? There should be, let's see, let's get excited. Anybody? Yes. I'm hoping there's jumps and screams. There one. All right, you guys, come on up if you want a hoodie and enjoy your seminar series. We'll see you back here at 11.
Good morning. I'm Sarah Bleich. I'm an associate professor here in the Department of Health Policy and Management. So just by show of hands, how many of you in either work or personal lives have done things around obesity or chronic conditions? Okay, so most of you. So I'm going to just quickly put us all on the same page in terms of prevalence and the problem of obesity, and then I'll jump into the work that we've done here in Baltimore, which is our attempt to truly try to make strides in addressing this issue among children. And so when we talk about obesity, we're talking about people's body mass index, which is your weight in kilograms over your height in meters squared. And so to put that in context, if someone is 5 feet 8 inches tall, which is my height, I'd be considered obese if I were over 200 pounds. Then here you have the metric conversion here. So probably most of you have seen these maps at some point, but I find it to be very illustrative of what has happened in a very short amount of time. And by any definition, the spread of obesity has been pretty profound in the US over the past several decades. So this is showing you the United States in 1985, and the blue colors are prevalences below 15%. The yellows are going to be around 20, the reds around 30%. And I'm going to advance the slides in just a second. Now, what this is showing you is self-reported height and weight. So what do you think happens when you ask a woman how much she weighs? She's all of a sudden thinner. And what do you think happens when you ask a man how tall he is? His height increases. So there's going to be some underreporting here. So these numbers are probably underestimated, but systematically what we see is that there are big increases over time. And so here's the story. The United States in 1990, 1995, 2000, 2005, and the most recent data from a few years ago. And so you can see that there are quite a number of states in that orange or red category, which is putting prevalences around a quarter to a third of the population. These are adults that are clinically obese. This is the exact same story in children and the exact same story around the world. This is showing you from a Lancet paper from a couple of years ago. Every single place where we have data points on obesity, even in some of the poorest countries, weight appears to be going up. Now, what's really interesting to me from a research perspective and a policy perspective is that while obesity prevalence has crept up quickly over the past several decades, it has not done so equally. And so what you're looking at here is a cross-section of the United States in the years 2006, 2008, and you've got white adults, black adults, and Hispanic adults. And what the colors are telling you is that there's a disproportionate impact of obesity on minority populations. If I showed you this by income, it would be the same story. As you can imagine, race and income are very intertwined. And certainly with excess body weight comes a lot of adverse health conditions. And in fact, it affects every organ system. And here you just have a short list, things like type 2 diabetes, hypertension, sleep apnea. And in a given year, roughly 400,000 deaths are attributable in the United States to poor diet and physical activity. In the literature, there's sort of a lot of back and forth. Is it smoking? Is it obesity? They are number one and number two preventable causes of death, and people will quibble about which one comes first, but there's no question that they are major causes of preventable death. So from a public health perspective, we have to ask ourselves, how do we reverse this trend? Because it is very expensive. So annually in the US, we're spending about $150 billion on the problem of obesity. And that, incidentally, is not primarily because people who are obese are becoming more expensive. That is primarily driven by the fact that the pie, or the share of the population that is obese, is getting larger and larger, and they collectively are very expensive. So there's all sorts of things that could be driving this imbalance. We have a very good sense that among adults, this is an energy intake problem. Adults are eating too many calories, and as a result, they're getting bigger. Among kids, it's more of a mixed bag, but certainly both energy intake and expenditure matter. And then you go downstream to behavioral factors, environmental factors, and development factors. And to be quite frank, we don't have a super strong handle on what is the relative contribution of each one of these different things to overconsumption and to physical inactivity. In my own personal interest, I focused on the drivers of obesity, disparities in care once you go into the healthcare system, and then how do you get kids to drink fewer sugary beverages? And that's where I want to focus today. And so how many of you have heard of calorie labeling as part of the Affordable Care Act or statewide? Okay, great. So basically what that is you go into chain restaurants, and this is now part of federal health reform. And so this is, I think the FDA is very, very close to having the final rule. It was supposed to come out last month. Hopefully it will come out this month. But basically, if you are a chain restaurant in the US with more than 20 outlets, when you walk in, calories must be presented in a prominent manner alongside price. So this could look like this example here at Subway, this example here at Auntie Anne's, this example here at Wendy's, or this example here at Starbucks. And there's a fair amount of discretion on the restaurant side as to how this information is going to be displayed. Now, the research here is pretty mixed. Some studies show that when you give people information, it matters, meaning it alters behaviors and causes them to purchase fewer calories, and other studies show no effect. In the restaurant setting, most of this calorie information is showing no effect. And this is an article that came out in New York City right when just the city of New York passed their legislation, which was about 5 or 6 years ago. And what they found is this was sort of the calorie winners, quote unquote. And so, for example, when people got this information for the first time, there was a fair amount of calorie shock. So at Pizzeria Uno's, a deep dish pizza was 2,300 calories. That's a single serving for lunch. And then another winner was Outback Steakhouse's Bloomin' Onion, which also has 2,300 calories, and that's an appetizer. And so you haven't even eaten your meal yet, and you've already taken in all the calories you need for one day. And so if you look at the literature around calorie labeling, one of the major gaps from our perspective is if you give people information and you simply tell them that a hamburger has 250 calories, is that meaningful if people, A, don't understand calories, B, can't calculate, well, if I'm supposed to take in about 2,000, what fraction is 250 of 2,000, and then C, do that very quickly in a real-world setting where there are lots of things going on at the same time. And so we asked this question of a national sample of adults in the US, and we simply said, do you feel like you understand what you need to know to make calorie decisions? And compared to white adults, Black and Hispanic adults said not so much. Do you feel confident about making decisions around calories in restaurants? Compared to white adults, Black and Hispanic adults said not so much. Would you eat in a restaurant that has information posted about calories? Compared to white adults, Black and Hispanic adults said, I'd be more likely to do that. That information would be helpful to me. So we said, okay, well, what if we gave people information that was more easily interpretable? Would that have an effect on behavior? And we chose to focus specifically on sugary beverages, an area which has gotten tremendous attention for good reason, which are that in the adolescent literature and in the adult literature, they are a huge cause of obesity. And that's sort of shown in clinical trials and observational trials. And I wouldn't say that it's a fact, but I'd say it's some of the most compelling evidence we have of a major driver of excess calories in the diet. So the typical adolescent takes in about 300 calories a day from sugary beverages, which is about 15% or so, or 20% of their total daily intake. And that's much higher, as you can imagine, than the current recommendations. And over time, there have been big increases in the consumption. This is showing you the time points. The gray is 88-94, the blue is 99-2004. This jump is particularly striking among adolescents, where there's been this big uptick among Black adolescents over the time period. So we ran a study, and we wanted to understand the impact of easily understandable calorie information on purchases of sugary beverages in corner stores. The idea here is that corner stores are a really critical area of study if you're in an urban environment like Baltimore, like Philadelphia, like Detroit, like Boston, where for low-income populations, a huge amount of shopping is actually not happening in supermarkets, it's happening in corner stores. And so we went into these stores, let me back up for a second, and all we did was, you've seen corner stores and they have these bank of beverage cases. So all we did was hang up on the beverage case one sign at a time. And the sign had 3 sources of information. The sign either said, did you know that a bottle of soda or fruit juice has about 250 calories? Sign number 1. Sign number 2, did you know that a bottle of soda or fruit juice is about 11% of your total daily intake? Sign number 3, did you know it's equivalent, a bottle of soda or fruit juice, to about 50 minutes of running? Post them one at a time, and all we simply did was first look at purchases without any information and then observe purchases with those different signs. What do you think compelled purchases more? Running, right. So that's exactly what happened. So this line here is showing you baseline, so relative to no information. And this is showing that with any information, so absolute calories, percent daily value, or this physical activity equivalent, which was in the form of running, there was a significant drop-off in the odds of purchasing a sugary soda. Most effective, as you guessed rightly, was minutes of running. When adolescents saw that sign, the likelihood that they'd buy a soda dropped by 50%. So very encouraging. And there was a lot of change in sort of what they were buying. And so what this is showing you is pre-post, how did the composition of drinks change? And so we saw a drop-off in iced tea, a drop-off in sport drinks, and an uptick in water. So that's encouraging. You post information, kids buy fewer beverages, and they're upticking in water. So we thought that was encouraging on our end. But there's still a lot of questions that remained from that study. So we thought, let's have another study and let's see what we can find. And so here what we wanted to look at was, again, what is the most effective source of information, but what are some of the other subtle outcomes? So if an adolescent walks in the store and they decide to buy a water instead of a soda, that is an achievement. But so too is an adolescent walking in and saying, all right, I'm not going to buy a bottle of Coke, I'm going to buy a can of Coke. You've just taken about 40 calories out of their soda consumption for that period. And that's a success largely because if you look at the increase in obesity over about a 10-year period among the pediatric population, so 2 to 19, the responsible calories, so the daily amount of calories on average that those kids are taking in is, guess how much? On daily average over 10 years to result in the current obesity levels that we have. 1,000 on a daily basis. 4,000. Okay, other guesses? 60? Other guesses? We've got 60, we've got 4,000. 100? So it's 165. So it's not a lot of calories. So if we, by having this sort of intervention, can chip away on a third of that or a quarter of that, that to me is an achievement. The other thing that could happen is you could walk into the store, you could see the signs and you could say, I'm not going to buy a drink. And so we evaluated that too. And the nice thing is that this whole volume issue that we just talked about was happening at the same time as the Bloomberg ban that you guys, how many of you heard of that in New York? So what Bloomberg wanted to do was say, you can't sell a beverage that's larger than 16 ounces in the city of New York in these certain retail establishments. And so we were able to test that with this study. So I'm going to quickly go over the design to convince you that it was reasonable and rigorous, and then I'll show you what we found, which is the more interesting part. So we're in Baltimore City stores. We're randomizing signs to stores. We're targeting Black adolescents. And to get at these kids, so we're not intervening with the kids directly. We are sitting in the stores and watching what they buy to get the true effect of information on behavior. And so then to identify all these stores, they have to be in catchment areas. They have to be in neighborhoods that are in walking distance to middle and high schools because we're targeting adolescents. They have to be in zip codes that are at least 70% Black. And they have to have water and diet soda available for purchase. And so to make this happen, this is me going all around Baltimore City and just going into these stores and saying, hey, do you want to be part of our study? And so there was some pushback around the idea of, I don't want you meshing with our soda sales because that's our key source of revenue. So that was expected. What I didn't expect so much is that a lot of stores simply don't sell water. So I assumed diet soda might be hard to find. But in a lot of places, they actually didn't sell water, and so they couldn't participate in the study. And so that was an interesting thing that I learned in the process. So this is what they look like. How many of you have had any chance to walk around the area surrounding this campus? A couple of you. Or if you spend any time in Baltimore, this is very typical. These are corner stores located in low-income areas in West and East Baltimore. We are on the east side of the city, and some of these are on the west side of the city. And so they're small. They have usually 200 to 300 square feet. Some are even much smaller. And they usually have lots of sugary beverages and lots of high-fat and high-sugar snacks. And so this is our shock. And so I told you the signs for the first study. These are the signs for the second study. So again, you walk into the stores, there's a bank of beverage cases, the signs are posted one at a time. Here's absolute calories. Here's our 50 minutes of running, sign again. Here's miles of walking and teaspoons of sugar. We based these signs off two things. We did focus groups with Black kids on the front end, and we showed them a whole bunch of different, is it dancing, is it basketball, is it running? And again, this issue of running came up again and again and again. Kids are more persuaded by negative messaging, and that negative messaging is running. It's not climbing stairs, it's not doing sit-ups, it is running. Kids don't like to run, at least in this sample. So that was very telling. At the same time, there was the sugar campaign that was going on in New York, and I'll show you that campaign towards the end, but they were using large amounts of sugar to illustrate what was in a bottle of 20-ounce soda. And so we wanted to also test teaspoons of sugar. And so, again, what we're doing, and I'll show you this in pictures rather than words, is we're going in stores and we're observing purchases by adolescents and a baseline period where no information is posted. We're throwing up a sign, letting the kids get used to it, and then we start collecting data for about 4 weeks. We pull down the sign, no collection happens. We put up a sign, let kids get used to it, and then start collecting data, and so on until all signs have been randomly posted in all 6 stores. Make sense? Okay. And so what we care about are 3 different outcomes in 3 different samples. So we want to know, because of the signs, do you buy fewer calories? And we're using volume and beverage type to get at that. Do you buy a beverage at all? And is that beverage a large volume beverage? And so to do that, we have to look, initially in the first study, we looked at just beverage purchases. But to understand if a kid walks into a store and then chooses to walk out and not buy a beverage, we actually collected information on all things. So we know if the person bought a snack and we know if the person bought a beverage. And then we did some fun, sophisticated analyses to get at our answer. And so this is hard to read, but I want to highlight two main points. The first is that at baseline, with no intervention, the percentage of sugary beverages in our stores is 97%. Of all the beverages purchased, 97% of them are sugary beverages among our study population. So pretty much every kid is buying something with added sugar, and very few kids are buying water. And the other take-home point to make is that there are some differences across these stores, and so we adjust for those differences in the model to make the analyses more rigorous. And so here, and I'm going to show you this in pictures, but I just want to give you the numbers first. So this is showing you our three outcomes: number of total calories, whether or not you purchased a sugary beverage, and whether or not that beverage was larger than 16 ounces. And I want to first direct your attention to this all-purchase sample. And before I do, I want to make one final point. The third thing that we looked at in this intervention, which actually hadn't been done before in any of these calorie labeling studies, was what happens to behavior at the end of a study when you take down the signs. So is there a persistent effect of information? And so we tested that. So at the very end, we've collected all of our data, and we just took down the signs, and we again watched what the adolescents would do. And our prior is that if you have the baseline right here, and as a result of the intervention, consumption drops to about right here, or purchases drop to about right here, in that post-intervention period, you should fall somewhere in the middle. You don't have the signs anymore, but potentially there's been some learned behavior over time. And that's exactly what we found. And so what this is saying is that at baseline, the typical adolescent bought 150 calories in their beverages, or 71% of them bought any SSB. In the post-intervention period, that dropped to 127 calories, and then somewhere it's right around any information. And then you can see the same thing for all beverages and the same thing for the SSB beverages. If you look at that in pictures, it's a lot easier to visualize. So here you have the baseline period and the post-intervention period. And you can see that among this all-purchase sample, everything the kids bought, baseline is post-intervention, is creeping up past these types of calorie signs, but it hasn't quite reached baseline. So the kids are learning a little bit in the process. You have the same thing for the all-purchase sample and the same thing for the all-SSB sample. And so then what changed in terms of the beverages? And so the first study we did not see a change in soda purchases. But in this study we did. So there was a significant drop in soda purchases to explain the change in SSBs. There was an uptick in fruit drink purchases, which I'll get at in a second, a drop in sport drinks, an increase in water, an increase in diet, and a big increase in the number of kids, or the percentage of kids, that walked into the store and chose not to buy anything. So what's going on with this fruit drink category? What do you guys think? Yeah. So that's precisely right. That's what I think is precisely right. So in these focus groups, the way we approach them is we bought about 10 or 15 different beverages, and we just put them on the table, or one at a time. And we asked the kids, is it healthy? Is it not healthy? And a bunch of them were fruit drinks, because it's sort of easy to distinguish a soda from a non-soda, but the fruit drinks are a very tricky category. And inevitably, every single time a fruit drink had a picture of fruit on it, they would say it was healthy. And if I countered and said, but it only has 5% juice, and it has as much sugar as soda, they were like, really? And this is in sequence. So you put one up, you take one down. You put one up, you take one down. And the answers were always the same. So I do think that what this is showing is that the kids are trying to make a healthy choice, but they just don't understand the best way to do that. And so we can test that and see what's going on there. But in this study, it sort of suggests that in steering kids away from sugary beverages, which I think there's a pretty good knowledge base around, drinking soda is not good for your health, we could be inadvertently, sort of the unintended effects of intervention, steering them towards a drink which is just as unhealthy as a soda. And I will say that I was also pleased and surprised to see that there was an uptick in diet soda. When I talked to the kids, and it was interesting, in the groups, some of them, we did 12 to 15 and then 16 to 19. And among the younger kids, there was less of an allegiance to different brands. But by the time the kids were 16 and 19, they either liked Coke products or they liked Pepsi products. And within those lines, they either liked Pepsi or Coca-Cola or Sprite or 7-Up or something like that. But among the younger kids, it was interesting because I said to them, would you consider drinking Coke Zero or Diet Coke? And most of them had never tasted it. But most of them said, well, it's not cool, or it doesn't taste good. And so the fact that there was this uptick in diet soda with what I think is a pretty common conception about diet soda not tasting good, to me was encouraging. Now, the flip side is, should you at all be encouraging kids to drink diet soda? Because there's a lot of questions about to what extent is that healthy. And we've actually done work to show that if you compare the total caloric intake among diet soda drinkers to sugary beverage drinkers, that diet soda drinkers actually eat more solid food. And some of the reasons behind that could be that you crack open your can of soda at 3 o'clock in the afternoon and it just pairs so nicely with a salty snack or a sweet snack. Whereas if you had water, you're not going to have that same physiological reaction. And the other thing is that there is pretty compelling evidence which suggests that the way we process artificial sweeteners is different than natural sweeteners. And there's actually something happening where you're tricking the brain into thinking that you're less satiated. And so as a result, your body demands more food. So this is an open question, do we encourage diet beverages or not? But to me, you know, as a minor uptick, I thought that that was encouraging. Any questions about this before I move on? Okay. So then what happened with volume? Again, what Bloomberg was trying to do in New York is his goal was, if people are going to drink a lot of soda, and we know that if you have a serving size which is this big and one that is 5 times as big, people tend to view it as a single serving. So a big gulp is a single serving of soda, and a can of soda is a single serving of soda from the perspective of the purchaser. And so you don't want someone drinking a 64-ounce big gulp, because then what happens is they're taking in a huge amount of discretionary calories. So Bloomberg's feeling was, let's just limit volume, and as an artifact, people will consume less. And so we looked at to what extent does this calorie information influence volume, and found that in fact that it does. So as a result of kids seeing information in the stores, the percentage of large volume sodas, greater than 16 ounces, dropped. The percentage of small volume fruit drinks increased. But there was an uptick in iced tea and large volume iced teas, and there was an uptick in sports drinks. And again, I think what that's showing is a lack of understanding about where the calories are. And so maybe someone thinks, iced tea is not bad for me. It's got lemons on the front. It looks healthy. Whereas soda's bad for me. So if I'm really thirsty, I'm going to purchase an iced tea rather than a large soda. And one thing that you may be thinking is, well, maybe it's summertime, and so they're thirstier. And we actually control for the weather in here and control for the time of year. So we are adjusting for the fact that preferences change over the course of the year. So I think this is actually a true effect. So our takeaway, yeah.
The science supposed to cut both fruit drink and soda on there, correct?
They did.
So if they were reading that both fruit drink and soda were bad, or they had to do that, why do you think there was still the rise in fruit drink?
Because I don't think people distinguish between fruit drink and fruit juice. And I think that if this was a fruit drink and it had fruit on the front, I think people think it's fruit juice. And therefore they think it's healthy. But then I would even add, do they need to be drinking 100% fruit juice? Like, it's a huge source of added calories, and our food is so fortified anyway, maybe just eat raw fruit instead. So I'd rather them have 100% fruit juice than fruit drink, but I think that's the distinction. They have no idea the distinction between fruit drink and fruit juice. Does that answer your question? Yeah.
I was interested, you're categorizing sports beverages, and that's like Gatorade, Powerade, but how did you, I know that vitamin water is like a really big deal. How did you guys classify that as like a sports drink?
That's a sports drink.
Okay.
Yeah. Oh, sure. So the question is, vitamin water is a sports drink. How do we classify it? And the answer is that we put vitamin water in the sport drink category. And so all of these drinks, we're actually visually seeing a person purchase a Pepsi, purchase a vitamin water, and we're recording what the beverage is and the size of the beverage. And the other question that was asked earlier was, is the fact that is the uptick in fruit drinks being explained by the fact that people think that it's healthier? And we're not sure about that. And then the final takeaway point from this study, and I think what's really novel, is that when you take down these signs, it appears to have a persistent effect. So people are learning as a result. And to me, the beauty of this sort of intervention is, a lot of you have probably heard in the media, there's been a whole lot of focus on sugary beverage taxes. There's even been a focus, less politically feasible, on so-called junk food taxes. Those things are really hard to pass and really hard to get the leadership behind them to make them actually a possibility. This sort of thing, and is evidenced by the fact that it was in the bipartisan Affordable Care Act, calorie labeling is a possibility. It is not going to fix the problem of obesity, but it is cheap, it is easy to do, and perhaps most importantly, store owners will buy into it and they will actually do it. And so I think that if you think about little Band-Aid solutions that can chip away at a problem, from a policy perspective and the environment, I think calorie labeling, if you use an easily understandable format, is going to be a really important one. And the fact that so many studies have come before this one in the restaurant setting and have not picked up effects, I think is largely due to the fact that if you just simply tell someone how many calories are in the food they eat, they can't understand it. And it's not that meaningful in a very short amount of time. Yeah.
Do you think in the long term, could restaurant or corner store owners will allow you will want to put up signs that
So good question. So certainly, me as a public health person, I have a responsibility to maximize public health. But if you're a store owner, you have a fiduciary responsibility to maximize revenue. Who cares about the health? And so what we have to prove, which we haven't yet, is that this sort of thing is cost neutral, meaning there's just some shifting that's happening. And so in a follow-up study, we're actually going to test that. But my sense is that so long as we can modify supply, so long as we don't modify revenue. So let's say they buy more water instead of buying soda, I think that'd be fine with store owners. And the interesting thing is Pepsi has said openly that it is not in our best interest to kill off our customer base. We want to have a viable product for many, many decades to come. And if we put products out there that are actually causing ill harm, that's not helping us in the long term. And so I don't think corner stores necessarily thinking that way, but the idea of we're just going to sell whatever people are going to buy is certainly how they're thinking. And what a lot of them do say when I approach them is, well, kids aren't going to buy it. And so part of my job is to demonstrate that if you put the water on the shelves, they're going to buy it. And one of our next steps is not to just put the water on the shelves, but put it in baskets by the register or put things in really visible, prominent areas, because that has been shown to actually alter consumption. Did that answer your question? Yeah.
You had some concern in regards to a lot of the fruit drinks had fruit on the wrapper. It looks really pretty and whatever. Has there ever been anything brought by the FTC about misleading labeling or anything like that?
So there's been lots. So the question is, the fact that there's lots of pretty fruits on the covers of fruit drinks, has there been any charges by FDA to say you can't mislead kids with false marketing? And this is an issue which hasn't, I don't think, received a huge amount of attention because basically you turn it around and it says, contains 5% juice. So I think they could argue that they are being truthful. And my guess is that, and so I don't know the answer, but my guess is that if FDA brought this issue, they would just simply change the labels and make them more consistent. But I don't think this is an issue that's gotten a whole lot of attention. I think it's more the issue of most people don't turn it around and they don't read. So I'm going to skip the strengths, and I'm going to skip this. And I just want to illustrate a couple of things in our last sort of 15 minutes or so. So this is the initial New York City campaign, Are We Pouring on the Pounds? How many of you guys have seen this in still or in video? About a third of you. So this was about 4 or 5 years ago, and if you were in the subway trains, it was posted up on the banners at the top, on the top of the walls. And this shows someone pouring soda and it turning into fat. And at the bottom it says, cut back on soda and other sugary beverages, go with water, seltzer, or low-fat milk. And here's other parts of the campaign illustrating teaspoons of sugar, which is why we wanted to test that message. And then this one in video shows someone sitting at the table and 10 pounds of fat falling from the sky onto their plate. And so these visually had quite a significant impact. And what I want to quickly show you, and I actually didn't cue this up, so I apologize, is how their ad campaign has evolved and how there's been an increasing interest in looking at sugary beverages from the perspective of easily understandable information. And I hope that this works. So this was, so this ad campaign came out a few months after the initial paper that we did, showing that this sort of relative information matters a lot. And from a common sense perspective, you can see how it's just more compelling to think about things in a more tangible format. Now, the policy issue is, and it's reasonable, but I think has an easy pushback, is, okay, so you're McDonald's, and you've got to put this information alongside price. can you really fit 50 minutes of running next to a hamburger or 70 minutes of running next to French fries? And I do think there are ways around this. For example, there have been studies which have actually just used stick figures. So you have a stick figure playing tennis, you have a stick figure running, and you just would put the stick figure up on the menu and you'd put like 50 minutes underneath or 70 minutes underneath. And part of it is sort of changing the culture of how people think about things. And so right now we have a nutrition facts panel, which is consistent everywhere you look. And you can sort of say, if I want to look at sodium, it's going to be in a standard format. You could think about ways to standardize how we give consumers this information and do it in a really easily understandable way. And I think that from a policy perspective, this is one of these windows of opportunity. And so the information is going to be in chain restaurants. There is a better way to do it. And so one of the things that I really try to do is push to get it in the most easy understandable format. And some of that movement may reasonably happen in the restaurants that are smaller than 20 outlets, not affected by the legislation, because they can be more innovative and potentially are not going to have such big corporate interests to counterbalance. So we're going to push this forward. We're going to have more stores. We're going to do this in Philadelphia and in Baltimore. We're going to look also at Hispanic adolescents and figure out for them which messages are most meaningful. Is it running as well, or is it teaspoons of sugar or miles of walking or minutes of basketball or moments of dancing? And actually test those and do that in 2 different cities and then see what we come up with. And so we're hopeful that 50 minutes of running will keep emerging, and so we could think about getting that actually integrated into restaurant menus. The questions before I move on this. Yeah. So the question is, if we find that the 50 minutes of running continues to be the more effective sign, how do we actually translate that into actionable policy? And that is the million-dollar question. And you sort of have to go at it from a bunch of different standpoints. One is to really generate media around it and generate the scientific base. Let's say that we have the scientific base, to really take the time to generate a media buzz around trying to get things turned, but then actually going out and probably starting at the local level. So much of the obesity prevention that's been effective has bubbled up from the local level. So what I would do personally is I would approach local chains here in Baltimore that are a little bit innovative, that maybe have a philanthropic wing or a wing of their company that sort of says we want to illustrate some social responsibility, and see if we can get a pilot in some sample stores, demonstrate effectiveness, and then build up from there. And I think it would probably have to happen not in the McDonald's of the world, but in sort of the local sandwich shops and the local hamburger joints, because dealing with those corporate interests would be very, very challenging.
And then maybe it would be
That's right. So much in the way that calorie labeling at the restaurant level has really bubbled up. It started in New York and California and other places, and it became part of federal law. And so I think that's going to be how you're going to have to address the issue. And the other thing that's really important is, who is the constituency? And so by framing things in the context of children, it is more compelling than framing things in the context of adults. People are swayed by the fact that children are impressionable, that they can't make decisions without full information. And it's reasonable to say, if kids don't know how many calories are in a hamburger, and it's about 600, let's give it to them in a way that they can digest it quickly and make better decisions. So I think that using the frame of let's affect adolescent obesity as opposed to adult obesity is going to be more compelling from a policy perspective. Yeah.
Do you believe that federal rule for the bigger chains is making it more favorable for these local ones that aren't necessarily mandated to do it, but they're going to have to come in and say, well, McDonald's sells me how many calories, why aren't you making this understanding?
Yeah, potentially. So one thing that's interesting is a lot of the change, so there's 2 parts to the question. Within the restaurants that are posting it, a lot of the change in the calories is actually happening on the supply side. So I showed you that article from New York where there was all this calorie shock. Oh my God, at Starbucks, a muffin has 800 calories. And so on the supply side, they're actually reformulating ingredients to pull out calories. So using low-fat mayonnaise as the default, changing the ingredients of muffins so they're not literally 800 calories. And so we are seeing that in chain restaurants. And there's an estimation that will drop calories by about 10%. Now, in terms of if you have, the question is, will the effect of chain restaurants posting affect smaller restaurants? What would probably happen, is my guess, is that if you are a burger joint, you're whatchamacallit burger, and you're next door to McDonald's. And as a result of posting information, which has been shown, you actually could increase volume a little bit because people are going to go to the place where they feel like they can make a better decision for the type of product that they want. Sure. for competition purposes, you might start posting it. And you might start then having these supply changes to make your calories more attractive. So I think that certainly anything is possible if it enhances competition. And so if they think that by posting it, they're going to increase revenue, absolutely. I think that they'll do it. So part of the job on our part is to show by doing this, you're not going to hurt your bottom line. And I think just to complete the thought, it's unreasonable for, let's take whatchamacallit burger again. Whatchamacallit burger, their business plan is their whatchamacallit burger and its secret sauce. Like, they are not interested in modifying that product, but maybe they bring in a line of salads. Maybe they bring in a line of breakfast items. Maybe they bring in a line of flatbread pizza, something that doesn't interfere with their core business, but probably attracts a different clientele and can be lower calorie. And I think that's where the movement's going to happen. It's not going to be core products. I think it's going to be on the auxiliary products where you can make changes and not affect what we know is whatchamacallit burger. And obviously the analogy there is McDonald's. They can't change their Big Mac, but they can change the salads that they offer. So I want to give you guys a flavor. Certainly, Hopkins is a very big school. We have about 500 faculty in the school alone, and there are a lot of people here that do work in obesity and chronic disease. And so for those of you that are interested in learning more about the obesity work here, I first encourage you to look at the Childhood Obesity Center, which has a website, and you can see the work that's done there. It is founded in systems science, and there's lots of faculty that are affiliated with that center. And then I just wanted to point out a couple individual faculty here at the school that do relevant work. So one is Keisha Pollack. She's in my department. She's an associate professor. And she's done a lot of work looking at the intersection between injury and obesity and the built environment. And some of that has involved firefighters. Some of that has involved workplace wellness. Most recently, she's used health impact assessment, a tool to understand the impact of policies on environments. And she's done this among the SNAP population. So you might have a look at her website if that sounds interesting. Another prominent obesity researcher is Joel Gittleson. He's done a lot of work related to corner stores. So he is the PI on a study for Baltimore Healthy Corner Stores, where he's gone in and made a whole bunch of changes to make the landscape, both in and around corner stores using recreation centers and other places, more healthy for kids. He's done that here. He's done that in the Navajo Nation among several different tribes. And so he is an anthropologist by training and has a lot of real-world experience just trying to make communities healthier. So for those of you that are interested in that side of things, he'd be a good person to talk to. And I just want to leave you with a final couple of points and then leave a few minutes for questions. The first is that one perspective is that it's not appropriate for public health to partner with industry. Industry is the devil, and public health is the angel. So if you sort of have the two on your either shoulder, look this way towards public health because they will tell you the right thing to do. My personal perspective, which is not the position of the school, my personal perspective is that public health has a lot of knowledge, but we lack reach when it comes to marketing and how to actually get information out there and make the changes. And so in the case of obesity, where so much of the solution has to lie with the foods and beverages that we consume, I think there are lots of interesting, reasonable, and important synergies that need to happen between public health and industry. And a lot of those already exist. There's the work that the Clinton Foundation has done with the Healthy Beverage Alliance, taking beverages out of schools. And so I think that in the world of obesity, there are lots of neat ways to think about public-private partnerships and the role that public health can play and the role that other industries can play. And the trick is to find that sweet spot. Again, so the gentleman mentioned corner stores, but think broadly about the beverage industry in general. They have a fiduciary responsibility to maximize revenue for their shareholders. That's okay. They're allowed to do that. And we in public health have a responsibility to improve the public's health. It is finding those initiatives which marry those two objectives which are going to be most successful. And then in general, what we know from the literature is that wagging your finger at someone and saying, you really ought not drink that sugary beverage is not going to be effective. And so you have to nudge people in the right direction. And so calorie information, again, is not going to be the solution. Pricing and other things are going to be more effective, but they're politically much more challenging. But even simple things like changing where beverage machines are located, making it harder for people to get to them, is going to have an impact on behavior. And these small things will chip away at it. The final message is when we had that big recession in 2007, we saw declines in all major industries. And what this is showing you is this is the S&P 500, a major market indicator. And what you can see is that it dropped significantly, as did Pepsi, Coke, and McDonald's. But they are the three industries that outpaced the S&P. Because at the time of the recession, People don't care about their health. People care about the bottom line. They're losing their jobs. They have limited funds. A lot of people lost a tremendous amount of money. And so health is a secondary concern. And that is not just true during recessions. That is true in general. Health is an important but secondary concern to the economy and to your pocketbook. And so when you think about ways to convince people and ways to engage public health and try to make it a tool for policy change, you have to consider that everyone's lens does not make public health a priority. And that is so true when it comes to obesity. It's such a high-profile issue. And so moving policy means not just considering what the science says, but considering the dollars and the cents. And when you follow the money, you can tend to be more effective. So I'm going to stop there. We have about 3 minutes left. This is my contact information. If any of you have questions, feel free to follow up. And in general, I would say that if you are thinking about, I want to speak to X and Y faculty member, it may not be possible today while you're here, I would guess, but shoot an email. And I find that people here are very amenable to taking 10 or 15 minutes to think about important issues. Or if you're sort of, deciding between schools and you want to understand different programs, you should definitely reach out to faculty and see if we can be helpful. Any final questions from you? Yeah.
I've read that one of the problems with obesity and education is that you get this immediate positive feedback when you eat something that's high in fat or drink something high in sugar. It's really the long term that becomes the issue, and people don't really see the correlation. Did you address that in any of the signs that you tested with the focus groups? This will be diabetes or addressing more of the long term. What they're eating and drinking.
So the question is, to what extent did we address the fact that people prioritize things today more than they prioritize things tomorrow? So they really want to have that bag of Doritos, and they don't care if they won't be able to fit into their skinny jeans on Friday. We didn't test that. That's a whole field of behavioral economics, which has shown very much that people know what they need to do, but they are completely irrational. And so again, let's use this example of your favorite pair of skinny jeans, your cute little black dress. You know that if you don't eat dessert between now and, let's say, next Friday, and you cut out about 400 calories a day, you're getting closer to your weight loss goal than if you eat dessert every day. But it just tastes so good, and it's chocolate, and it's your favorite, and you say, I'm just going to go ahead and have it. And so there's been a lot of work which has tested how do you help people get around, how do you use different cues to help people make those decisions. But I would say that the most important thing is actually just changing the environment that surrounds us. And so it's hard to say no to chocolate cake when there's a big sign of chocolate cake in front of you, and it costs $1.50, and it's very convenient to get to, and it tastes really good. It's easier to say no to chocolate cake if it's just not around, and it's really expensive, and you don't have lots of marketing that's being bombarded. And so just as public health use seatbelts to make cars safer because we don't have governors in cars, we have to think about this environment that surrounds us, which encourages overconsumption and discourages physical activity. How do we actually architect and engineer it to be healthier? And I think that's going to have to be the solution in the long term. And we are at time, and you guys need a break, so take 10 minutes and enjoy the rest of your day here.
My name is Dina Wagner.
My name is Fumi Olaolorun.
My name is Adam Hoffer.
I didn't know much about the city, and it was really fun to move here and learn about the different neighborhoods and explore what it has to offer.
I really do think that this is a great city where people are walking around, lots of people have their dogs, and it's really a comfortable, relaxed environment.
I think that the media that Baltimore gets is quite unfair because it is a great place to be.
So one of the great things about Baltimore is that they do make it bike accessible, and there's lots of places downtown that you can bike through, major roads and everything to get where you need to go, and a lot of students do bike to class.
I love the fact that there are many places that families can go and spend time together.
I think it really is a city of neighborhoods, and being able to do different activities on the weekends and try out different restaurants and stuff like that has been fun.
So one of the great things about Baltimore, it has a really thriving live music scene, and there's lots of local venues you can go see.
When I first started looking for apartments, it was all online, and I thought they were surely a scam. for what I was paying for a tiny, tiny 1-bedroom in Boston, I could get a 2-bedroom apartment here in Baltimore and pay less at that.
It's quite affordable. I have family living in New York, DC, and it's really significantly more expensive, and that makes it possible to use your money towards other activities that you might enjoy doing while you're in Baltimore.
It's a comfortable feeling I have to be able to focus on my studies and not worry what's happening to my son, because I know he's in good hands in school. I think everybody brings different things from their backgrounds, and it's really very useful to be able to learn from other students, because I think at Hopkins the students are as great a resource as the faculty themselves.
Who can beat Hopkins? You know, might as well go for #1, right?
Welcome back. We promise we won't throw that #1 thing out too much more. So I hope you all enjoyed the Bloomberg Seminar Series. Before we do move on to the next presenter, I did want to let you know I have an iPhone. You have to tell me what is the picture on the screen in order to get it, but if somebody lost it, I have it. So just please come see me before you leave for lunch. I would like to introduce our next presenter. As you can tell, we're kind of shifting gears. We're going to talk more about Baltimore, about SOURCE, which is our Student Outreach Resource Center, and then we're going to be opening into a student panel where you have the opportunity to ask our current students some questions about Baltimore, about life as a student, about access to faculty, whatever you want to ask, this is your time. So I would like to introduce our next presenter who's going to talk about SOURCE and then give you an intro to our lovely city. Her name is Elizabeth Dorr, and she's our Associate Director of our Student Outreach Resource Center. Elizabeth, where are you?
Hi everyone, as Leslie mentioned, I'm Elizabeth Dorr. I'm the Associate Director of SOURCE. So I'm just going to give you a very brief overview of SOURCE and what we do by connecting students in the community, but I'm also going to give you an overview of Baltimore and resources that you can get to know the city a bit more, logistics and getting around the city, etc. So SOURCE stands for Student Outreach Resource Center, and we're the community service and service learning center for the schools of medicine, nursing, and public health. So we actually support all 3 health professional schools, which is a really cool way to get involved with other students in the health professions. And so what we do is provide a variety of different opportunities to collaborate, for students to collaborate with public health organizations in Baltimore. So some of the reasons that we recommend getting involved in Baltimore and working with a community-based organization, some of it is self-explanatory, but some of it, is really something to think about, especially in supporting your academics. For you, this really gives you an opportunity to apply theory to practice. So you're going to be learning all this great stuff in the classroom, but this is a way to actually put it into action in real time. You're also providing assistance to understaffed nonprofits. It's a career development opportunity. It's a great networking opportunity as well. And it's also a really great way to learn about Baltimore in general. I know that a lot of students have done a lot of the activities that I'm going to mention later, but actually getting involved with the community-based organization provides a deeper level of understanding about the community. And in the end, you can really, truly make a difference. The projects that our students work on are important to the community-based organizations that they work with. So Baltimore is like any urban center with a lot of the health issues that go along with working in an urban city. High rates of diabetes, hypertension. It's not unique in those regards, but there's a lot to learn and about health indicators in Baltimore, and getting involved with a community-based organization is a great way to do that. So we partner with about 100 different community-based organizations. They're all in Baltimore City. And here are a number of, and this is a general list of what they focus on. You can actually look at our website for a specific list of all of the organizations that we work with. So some work with public health directly, some are more indirect, but everything is related to health disparities and at least in a general way. We have a lot of different involvement opportunities. So oftentimes people think of a volunteer center as being just one-time service activities, and we do have those. We actually have 2 tri-school days of service where all 3 schools come together. We do a day of service, but we also have long-term projects, and we connect with courses. So some of the courses that you might take actually have a community-based component. Those are called service learning courses, and there are a lot of different opportunities. This is just a list of some of the things that you can do at Source. You can also find out more on our website on what you can get involved in. And just a list of some of the programs we have. We have an annual community involvement fair every September, so right after you get here. We'll have a room where all of our community-based, well, not all of our community-based organizations, but many of them that have current opportunities that you can actually talk to and see the staff from the organization. We have Baltimore Week in October, where we have a lot of different activities that educate our students and faculty and staff about Baltimore, what's going on in the community, engaging in dialogue. And then we have National Volunteer Week, which is actually coming up in a few weeks in April, which is, we have a lot of celebratory events and a tri-school day of service then as well. So if you have your phone and you want to stay connected to Source, I highly recommend getting on our weekly service scoop. We only send this out once a week on Tuesdays. It's only used for that newsletter. So just email source@jhsph.edu. And we can put you on the scoop, and that actually has the current activities, and it's a pretty long list. It can be kind of overwhelming, but for those of you who are interested in getting involved in the city, this is a great way to see what's going on in real time. And then Facebook is also, we have a lot going on Facebook as well, so like us there. And we'll be out at the involvement fair if you have any other questions as well about Source and what we do. But now I'm going to talk about Baltimore. So just a little background on myself. I'm not from Baltimore originally. I'm originally from Washington State. I lived overseas and in D.C. for a while, and then found myself in Baltimore a couple years ago. And I have to say, since leaving my home in Washington, this is the first time I've really felt at home in a specific place. It's an amazing city, and really just a great place to eat. There's great food, and just to get to know. Yeah, I'm saying. So just as a show of hands, how many of you are actually from Baltimore? Okay. Oh, a few of you, but not very many. How many of you have been to Baltimore before today? Not today, before today? Wow. Okay, not bad. All right. So I'm going to give you just some little things to think about Baltimore, and then we'll talk about, some logistics and getting around and what to do here. And then after that, we'll have a student panel that'll actually talk about living in Baltimore, and you can ask them questions. And again, I'll be here later, and you can always ask me some questions as well. So the first thing to know is that you need to brush up on your Balmorese. Coming from Washington State, I wasn't as attuned to Balmorese. But Balmer, you're going to hear people say Balmer, that's Baltimore. Merlin, that's Maryland. Downey Ocean, summertime vacation spot in Ocean City, Maryland, means down to the ocean. Hun, you're also going to hear Hun a lot, and you're also, it's oftentimes hear about Huntown, or it's the town of Huns. It's a friendly greeting that comes from the word honey, and it's a term that really embraces Baltimore's hidden funk. And actually, the neighborhood, the Hamden neighborhood, is kind of the center of Huntown, I guess. There's an annual event called Hunfest in June, which is pretty cool. Embracing that, they have a Hun contest. You can see those ladies with their beehive hairdos and their cat-eye glasses. It's pretty cool. Some other Balmorese, amblets. This is something you might hear being on the health campuses here. Arn, it's what we do with wrinkled clothes. Arn, wash, what we do with dirty clothes. That's actually what people in Washington say too, Washington. The O's or the Oreos, that's our local baseball team. So that's another one. And I forgot to add it here, but one is Jeet. Did you eat? All right. I know I should have asked what you thought it said. So there are a lot of famous people from Baltimore, and just so you know, this is not an exhaustive list. Every year, Mindy, my colleague who usually gives this talk, gets an email that says, well, you missed this person and you missed this person. So this is just a smattering of folks that are from Baltimore. So John Waters and Barry Levinson, the filmmakers, are from Baltimore, and you might actually catch a glimpse of John Waters occasionally in Hamden, because he has his office there. So he's the guy that kind of helped manifest the Hun culture, the current Hun culture. Kwesi Mfume, the former CEO of NAACP. You have Monique, the Academy Award winner, Cal Ripken Jr., Olympian Michael Phelps, and the list goes on. And you're also going to see a lot of Edgar Allan Poe around. He's a famous Baltimorean too, and there's a lot of Poe-themed stuff going on. I always think that's kind of a fun scavenger hunt around the city. Some local leaders to know about. We have Martin O'Malley, the governor of Maryland, Anthony Brown, the lieutenant governor, Stephanie Rawlings Blake, the mayor, Jack Young, the city council president, and then we have Dr. Auxeries Barbeau. She's currently the Baltimore City Health Commissioner, but she's actually going to be leaving and going back to New York, her home, in April, so we'll have somebody new. But I mention these folks because they often come to Hopkins to visit, and students get a chance to interact with these local leaders, and there's a lot of recognition of how of Hopkins' role in Baltimore City and Maryland in general. So living in Baltimore, I know all of you are dying to hear about what this is all about, but getting around is actually fairly easy here, and I think it depends on where you live, and so it's really good that you're going to hear from students that are talking about where they're living. But there's a shuttle that operates between Homewood and the health campuses. It lets off right in front of the hospital, and it goes between the Homewood campus in Charles Village to Peabody in Mount Vernon and to the health campuses. There's an Eastern Campus shuttle, so it goes between JHMI Eastern Campus, which is up kind of near Waverly and Charles Village, and then also the Homewood campus. Mount Washington Green Springs shuttle. There's also a couple of local shuttles that go from just from places that could be walking distance, but if it's really cold, it's nice to have a little shuttle from Butchers Hill. And the Collegetown shuttle goes between Homewood campus and other universities like Goucher College and Towson area up north of Baltimore. You also have the Metro and Light Rail, which is a subway. There's one line, but it's great for folks who are living just outside the city or in those lines. Very easy to come in. The Amtrak and MARC trains makes it very easy to get up to New York, and the MARC train is the commuter train between Baltimore and DC, and they actually just started weekend service, which is really exciting. So you can take the MARC train down to DC, and that goes from Penn Station in downtown Baltimore. And then you have a number of bus lines. We have the Charm City Circulator, which is a free bus service that has three different routes, and that you can find out information on that on their website. BWI Airport is located a mere 20 minutes south of Baltimore. It's very accessible, or by car at least. It's very accessible by train, car, taxi. You also have water taxis, zip cars, et cetera. There are a lot of ways to get around the city. So for galleries and museums, there's a ton going on in Baltimore. It's some really cool stuff. The American Visionary Art Museum it should not be missed. It's really one of the coolest and most unique museums in the country. You also have the Walters Gallery. You have the Baltimore Museum of Art, both of which are free. You have the aquarium. There's really a lot to do. And Baltimore is also a hub for history. So if you're a history buff, this is a great place to learn about Maryland and Baltimore's role in the Civil War and going back. So there's a lot there's a lot around the city where you can learn about that. Theaters and concerts I know that the guy in the video mentioned that there are a lot of popular bands that come to Baltimore. They play at Pier 6 Pavilion, at Ram's Head Live, which is not on here, but you can go see the Aver Brothers at Pier 6 concert, but you could also see Book of Mormon, which was just at the Hippodrome recently, which is pretty cool. And then you have the Creative Alliance, which celebrates more local and independent art and music. And so it's a pretty great place to see everything, really. There are a lot of fun and unique community-oriented activities. One of my favorites is the American Visionary Art Museum's Kinetic Sculpture Race. That is basically pedal-powered sculptures going around the city through various obstacles, and you can see the pink dog there is part of that. It's pretty hilarious, and that's actually the spring. Also, Hamden's Miracle on 34th Street. So Hamden's kind of the center of the Hun culture in Baltimore, but they have a whole street, 34th Street, that covers their houses with lights, and it's not your typical light show. They're kind of you have a tree made out of hubcaps, and you have just some tacky stuff, and also some stuff that it celebrates Baltimore as well. And here are a number of other activities as well. Shopping, there's a lot to do. So for kind of logistics, if you need to get stuff from Target, Canton Crossing just recently opened, and it's really close to here. It has a Target, a Harris Teeter, and it's within the city, so people are really excited, and they're very popular, especially those who live in Canton and Fells Point. And then you have all these other malls that are close by. And then you have the popular shopping areas that have specialty stores, boutiques, antiques, like Mount Vernon, Charles Village, Hamden's, the Avenue. It's all local stores that you can find on the Avenue there. So those are some examples of shopping areas. So I mentioned food earlier. I'm a big fan of the food in Baltimore. So Baltimore's Best Restaurants in Baltimore Magazine is a great resource to find out good food in Baltimore. I mean, pretty much every neighborhood has their local watering holes and local restaurants, neighborhood restaurants that everyone loves. And some other, I also want to point out the municipal food market. So that picture on the top there is actually from the Lexington market, which is actually the oldest or longest running and largest public municipal market in the city, or not in the city, in the country, maybe even the world, but I think it definitely in the US. So there are about 6 municipal food markets. One is actually right down the street in Northeast Market, and this is where a lot of folks from Hopkins actually get their food. But they have prepared food, there's produce, candy, all this great stuff. Highly recommend checking out Lexington Market because it's big, but make Northeast Market a bit. If you come here, make sure that you make it a big part of your regular day-to-day life because it's pretty great. And the food truck culture in Baltimore is really growing as well, and you can actually see a number of food trucks on the corners here at Hopkins on a regular basis. Pretty much every day there's a food truck. Sports. Sports are huge here, and you can see Mindy, she's on the right on the bottom picture. She's the director of Source and couldn't be here today, but she attended the Super Bowl last year when our Ravens won. She's a huge lifelong fan of the Ravens, or at least life of the Ravens fan. So that's an example of great sports that you can attend. You have the Orioles baseball. You have a lot of Hopkins sports as well. Lacrosse is really popular, and the team here is excellent. Charm City Roller Girls, roller derby is pretty awesome. So you have a lot to choose from. And then if you're interested in getting involved in sports, you have the county and city recreation councils, Baltimore sports and social clubs. You can find out what recreational teams we have here. And Baltimore is in a great geographic location to just get out of the city for weekend or day trips. You have DC, New York, you have Annapolis, which is really cool. But you also have the outdoors, like the Catoctin Mountain National Park, Gettysburg National Park, et cetera. There's just a lot to do in this area, and it's very accessible. So some housing resources. I know, the moment that you accept it, you're going to be looking for housing. And so these are the most popular sites to find housing. Craigslist is actually very successful for a lot of students, but you also have the JHMI housing offices. And we'll talk more about neighborhoods when the students speak, but here are some recommendations from students who have come to other students from Hopkins. Charles Village is right next to Homewood, Mount Vernon, Fells Point, Canton, Patterson Park. These are all neighborhoods that are either walking distance or near the shuttle stop. And so these are very popular neighborhoods for housing. Some other resources, if you're interested in looking for places of worship, childcare and daycare options, and then other parks and recreation information in Baltimore, here are some resources that you can look into. And then just general living in Baltimore resources. These are local publications. The newest one, What Weekly, is an online magazine and has a great weekly newsletter that updates you on what's going on that week in Baltimore. So there's some very cool stuff going on in the city that you can find in these resources. So thanks. Okay, so that wraps up my talk, but we're going to have students come in and talk about their neighborhoods, and I'm going to hang around too if you have any questions about Source or anything else that I talked about.
Thank you. So as our students, come on up. Students make their way up to the stage. We are, we're going to start, as we mentioned, we're going to have this time for you. We have a few students, and I think a couple more may be on their way. So we thank them, first of all, for taking some time out to meet with you all today. But this is your time. So this is when you can ask those questions that you want to ask. We can talk about housing, and I know Elizabeth has given you some helpful information about Baltimore. I've also lived here for almost 10 years this summer, and I've lived in the city, I lived in the county, I have a dog, have babies, whatever. We're going to get those questions answered for you. So why don't we start off with first each of our students kind of letting us know your name, where you're from, what department you're in, and where you currently live. Yes, I'm sorry. You could sit on. There you go.
Okay, I'll go first. My name is Christina. I am in the full-time M.P.H program. I currently live in Mount Vernon. If any of you know the Belvedere, it's a really cool old hotel, and they have apartments, and that's where I live. Hi everyone, my name is Lavanya. I'm also in the full-time M.P.H program. I'm also doing a Master of Social Work at University of Maryland, so I'm a dual degree student. I live in Charles Village. It's closer to the Johns Hopkins Homewood campus, which is an undergraduate campus.
How's everybody doing? My name is David. I am a Ph.D. student in the Department of Mental Health. I'm actually from Baltimore, born and raised. I'm on the east side. I still live on the east side. My home is like right down the street from here. So that's where I'm coming from.
Hi, my name is Kelly. I'm a first-year doctoral student in the Department of Health, Behavior, and Society. I'm from Detroit originally. I just moved here for the program, kind of not knowing anyone. So if you're in the same boat, feel free to ask me questions about that. I live in Butchers Hill, which is Upper Fells, Butchers Hill. They're kind of called the same thing. It's, you kind of just head down the hill a little bit towards the water. It's that neighborhood. I'm also moving to Mount Vernon in a couple weeks, so happy to talk to you about both of those.
Hey everyone, how's it going? Good. My name is Lauren. I'm an M.P.H student, and I'm living in Upper Fells, which is, as she said, like it's just it's like a 12-minute walk away, which I really like, so I can walk to school and back and forth, and it's really nice. And then a little background on myself. I'm from Massachusetts. I don't know if there's anyone from Massachusetts here.
Yay!
All right. So I'm from there, which is, you know, you don't talk to anyone. You don't talk to your neighbors. But I really love my neighborhood here because everyone's really open and nice, and I like that. So yeah.
Great. So before we start opening it up for questions, and just so our panelists know, this map is in your packet, and it does, I'll do my best to use this very fancy red pointer to try to locate the different areas. The best way to kind of split up the city in terms of looking at the east, the north, the south, the west, is those red lines that kind of go through it. Sorry, I have to keep talking over here. The red one that goes north to south, this is Charles Street, and then the one that goes east to west, that's Baltimore Street. So that's a kind of a good way to kind of, when we talk about the east areas or east, you know, things like that, you'll be able to kind of get a gauge of where we're looking. It's a small map. We did used to have these on multiple pages, so this is our attempt at putting it all on one for you, so that you can kind of see popular areas that the students live in. And also, because we are recording this, the questions that you ask, I need to repeat them, so please make sure I'm getting your question accurately, and I'd be happy to switch that up as well. So let's open up the floor. Who has the best first question? Yeah, go ahead. Hold on. The question was, does any of you have any pets, and what is it like to have pets in the city?
I have a dog. First of all, she's the best dog in the world. And so I took that into consideration when I was looking for housing, because I needed to live in, one, a dog-friendly house, and two, close to an area where she could walk around safely. So I live in Upper Fells in a row house, and dogs are allowed there, so it's just me and 2 roommates. And then I live about 3 blocks from Patterson Park. You can see it on the map. It's the giant green space. And so I go there about 3 times a day, and we walk around the park, and it's great. And I've made friends with dog people. So yeah, it's really, I like Upper Fells for having a dog.
And also, just to interject real quick, I didn't point out this very fancy star. That's where we are. Anybody else want to add? Well, I just want to add, I also have the best dog in the world. And I lived in Canton area, and there's actually, along the water, there's a promenade that you can walk and walk and walk and walk. Everybody's out with their dogs. And so it's just a great dog-friendly area for sure. Next question. Over here.
I don't know if you guys live alone or have roommates, but trying to make living affordable. Is getting a roommate a good idea? Does that help towards housing costs? And if so, how did you find living?
The question is how to make housing affordable, and what is the process for these students as far as finding roommates?
Okay, so I was very much thinking about the same things when I was getting ready to move to Baltimore. So I currently, as I mentioned, I live in Charles Village, and I live in a 5-bedroom row home. So I live with 4 other people, and yes, I think having roommates and having more roommates makes it definitely more affordable to live here. But generally speaking, compared to other East Coast cities, I think Baltimore is pretty affordable. So the way that I found my current living arrangement was through Craigslist, and that was pretty much the only place I looked. And I was living in Philadelphia at the time, so I just kind of, set up appointments with 2 or 3 different people that I had found on Craigslist, and just came down on a weekday and just met with them all and finalized it right there. So, and I'm fine to share, how much I'm paying for rent and everything. So there's 5 of us, and I'm currently paying $5.15 for my room. I think that's pretty much like on the very lower end of what you'll find in terms of the cost of rent. I think on average people pay between $700 and $900, even when they're sharing with roommates. So I don't know if anybody has differing information or if that's like what you guys have found too. But yeah, that's been my experience. I'd just like to add, great question. I was also thinking through a lot of the same things. I didn't know many people here when I moved here, so I decided to do the Craigslist, move into a row house thing as a way to meet people, and I think that's a really good option. And there's also the school's website to kind of get linked in with other students too. I'm now moving from a row home that had 3 roommates to live alone. I'm a doctoral student, and I'm starting this life here, and I'm an adult now apparently. So these were some things that factored into that. My rent when I was sharing the house in the Butchers Hill Upper Fells neighborhood, it was 1 room in a 4-bedroom house, and it was $750. I'm now moving to the Mount Vernon neighborhood, and it has a covered parking spot, and it's $1,100, which is definitely more than I should afford, but I'm just gonna do it. And the amount that I was paying in parking tickets, quite frankly, is gonna even it all out, so I'm feeling really good about the choice.
Just want to add about parking in the Upper Fells neighborhood. If you're planning on bringing a car, it's really difficult, but the advantage of being a student and living there is that your schedule is going to be different from everyone else's, and I find that as long as I get there before 5 o'clock, I can park right in front of my house, and it's free, so that's also good.
If you get there after 5 o'clock, it's so difficult. And I think something to consider is like, I like study late, those are the hours I keep. So if I'm like in the beautiful secret 4th floor reading room studying until 12:30 and then heading home, like I am gonna be walking alone at night as a woman, and like, I don't like to do that anywhere. It's not necessarily less safe here, but that's just something to consider. Parking is tough in that neighborhood.
I don't really have much to say. As far as finding a roommate, I just dated mine, so that made it very easy. But I can definitely attest to the parking. Even where I live, it is difficult. I've gotten quite a few tickets. I actually was in court a couple of days ago fighting a parking ticket. I did win, so that was awesome. But yeah, parking can be tough. You'll figure out your own schedule as far as being a student, and you'll figure out the schedule of your neighborhood, because I've definitely noticed mine's, you know, even when I park as close to the school as possible, that neighborhood has its own schedule, so I know when I should be coming to find a parking space, when I shouldn't be coming to find a parking space. But definitely get to know the restrictions in your various neighborhoods, because they do change, and this city likes to get its money. So they will find you, they will give you a ticket, and it's not cheap. So definitely learn the restrictions, learn the loopholes too, if you can. Learn the loopholes, because sometimes you can kind of sort of get around it, but definitely learn the restrictions in your neighborhoods when it comes to parking. It helps a lot.
I'm going to jump in on this topic that was not at all related to your question about parking. I sold my car before I came here and have been using public transportation, and it has served me very well. So I think that that is an option. I don't feel like I need a car. I have Zipcar if I want it, but I've used it like 3 times since being here, so something else to consider.
I also just wanted to jump in on the parking thing, and I realized that I forgot to answer the second part of your question about how I found my roommates. The short answer is I didn't find them, my landlord did, which was great because I didn't have to go through that hassle, but at the same time it was kind of an uncertain living situation. I didn't know who I was going to end up with. But she had an 8-page application to live in her properties, so I think she did a very thorough screening process, and she tried her best to match personalities and like age and stage of life and things like that, so it worked out really well, and I love the people I'm living with. And related to parking, Charles Village is really easy parking, so if that's a major consideration for you, definitely keep that in mind. And also, Charles Village is along the Hopkins shuttle route, so that's what I take to get here every day. I don't like to drive because, as the other folks have mentioned, parking in other neighborhoods and on campus here can get pretty expensive, whether it's to pay for parking or tickets. So I like to be environmentally friendly and take the shuttle, so it's super convenient. It runs pretty frequently, especially during rush hour times, so that's something to think about.
And just to kind of go along that, I don't want to steal the time. To answer your first question, there's also like 115 people here that could be potential roommates. Anybody want a room? But also along those lines, a lot of our students do choose, so they don't have to worry about parking. You live near a shuttle stop for one of our Hopkins shuttles, so then you don't have to deal with all that stuff, and you can avoid going to court for parking tickets. Next question. Yeah. Is there a particular street you would recommend living on for people who do not have cars?
So I think that you have to think about a lot of things when you're figuring out which neighborhood is the best fit for you. Baltimore is very much a city of neighborhoods, and each one has its own flavor and pros and cons. I think that the Mount Vernon neighborhood is really great if you don't have a car. It's really walkable. There's a lot of bars and restaurants and coffee shops and museums and everything right there. And if you do want to go down to DC or to the airport, Penn Station is there, which is super convenient. There's also, similar to Charles Village, there's 2 Hopkins shuttle stops in Mount Vernon. So I think that without a car living in Mount Vernon, if you pick, like, I forget, one of them picks up on Mount Royal. I don't know where the other one does. I don't know if anybody else knows.
I have it right.
Oh, yeah.
That's the breakdown. It's on the other side of your map.
Yeah, I think that's a pretty like walkable, good neighborhood.
I was just going to add about Charles Village and also the streets. I think St. Paul and Charles are the 2 main corridors that go north and south. They're both one-way streets, so they go in opposite directions, but they're kind of the main thoroughfares. So there's a lot of, all the Baltimore City buses run on those streets. The Hopkins shuttle goes on those streets, so it's a pretty convenient place to live. And there's lots of restaurants and stuff in Mount Vernon on those streets. And also in Charles Village, it's also pretty walkable, but it's in contrast to Mount Vernon, it's much more residential, so you won't see as many restaurants and bars. So if you like a quieter living environment, Charles Village is definitely will give you that. And there's grocery stores within walking distance in Charles Village, and also because it's close to the Homewood undergraduate campus, there's the Blue Jay shuttle that runs there, which is different from this Hopkins shuttle, but the Blue Jay shuttle runs kind of within, I don't know, maybe like a mile or so radius of the Homewood campus, and so you can take that to get to the Giant and other major, and there's a Safeway as well, so that's convenient too.
And then I just want to plug my neighborhood again. Upper Fells and also Butchers Hill, they're walking distance from school. So even though I have a car, I have it for kind of other reasons. Like I drive home to Massachusetts, I drive to visit my sister in DC. In terms of living every day in Baltimore, I don't use it ever. I walk to school, and I also have 2 roommates that are students at Hopkins, and they don't have cars. So if you're looking to walk to school, Upper Fells and Butchers Hill are really good options.
Okay, let's get somebody in the back. Yeah.
I know all of you live in the city, but do you know any students who live their experience with it?
So the question is, all of this panelists here live in the city, but do you know of any other students who live outside of the city and what their commute is like?
I don't know any students, but my genetics professor has commuted from Pennsylvania for like 13 years.
Whoa.
I don't know why he does it. I don't know how he pulls it off, but he's always on time. But so I don't really know any students. I would say students probably wouldn't live any further than maybe Baltimore County, and even still, that's not a bad commute. Your only issue may be taking the Beltway, especially during rush hour, can be kind of crazy. But if anybody's familiar with the Capitol Beltway down in DC, it's not nearly as bad as the Capitol Beltway. Ours is not so bad. So just kind of a point of reference. The county is an option. Yeah, you'd have to wake up a little bit earlier to get here on time, but it's not too terrible.
I would just add, one of my dear friends in my program, her fiance and new home and life are all in DC, and so she lived in DC and would commute on the MARC train, which I think during the time she was coming and going, she would kind of treat her hours 9 to 5, and it's about 45 minutes to an hour. I think that, she would use the time on the train really effectively to do work and read for pleasure, not that any of you will be doing any of that. And I think that, it did get a bit exhausting, so I think that it is an option, but I also just want to take a moment and plug Baltimore, because some of you may be nervous about Baltimore if you haven't lived here, but as somebody who moved here strictly for this amazing program, it is awesome, and I, don't want to leave, and I probably won't. So see you next year.
Okay, next question. How about right here?
You guys are talking about public transportation. Is it fairly affordable, the train and stuff, and is it easy to navigate?
Is public transportation affordable and easy to navigate?
The subway is one line that runs from Hopkins to Owens Mills and back. So yes, that is very simple. It's fairly affordable. You can get bus passes as a student, which will make it even cheaper than if you were to get it outside of the school. There's also the Charm City Circulator, which is free, and that usually is just kind of circling downtown. So if you're trying to get to downtown or do anything in that area, hop on a circulator and go. Again, the Hopkins shuttle can take you close to those areas as well. And yeah, between the public transportation, the Charm City Circulator and the Hopkins shuttle, yeah, you wouldn't be spending a lot of money to get around the city. I mean, it's not, most of what you'd want to do, I'm figuring, is very close to this area. If you want to venture out further, that may cost you more. You can take the MARC train. The MARC train goes into DC, so that's no more than about an hour or so. That's pretty affordable. The airport, if you want to get to the airport, again, you can take the light rail or take the MARC train to get to the airport. Again, that's very affordable. So anywhere that you'd want to go in the immediate vicinity, and even if you wanted to venture out into DC or anywhere in between Baltimore and DC, wouldn't be very hard. Or even if you want to go up to Philadelphia, New York, and things like that. With Penn Station, you can pretty much hit the whole East Coast, and it's fairly affordable.
I would just say, when David's saying affordable for the train to the airport, it's like $3.50 from Penn Station. So like very much affordable. The other thing I want to plug is Bolt Bus. I went to school on the East Coast. All of my friends live in Brooklyn. And so like I was going into New York a lot. And if you get your tickets in advance, especially, like you can get Bolt Bus tickets for like $15. That'll take you into the city. It's 3.5 hours. There's internet. It picks up right by Penn Station, which is great.
Okay, next question. How about right there in the middle? Okay, so the question is Baltimore a bike-friendly city? And the second question is, how much would a one-bedroom apartment cost typically?
So I moved here from the Twin Cities of Minneapolis, St. Paul, which is a very bike-friendly city. And in comparison, biking from Mount Vernon, where I live, is not something that I would personally do. There are people who do, who are like super gung-ho, but there aren't a lot of bike lanes. So if you're somebody who is comfortable asserting yourself in the lane, which you have the right to do, then it's totally bikeable. But if you are a more timid biker, then it probably honestly isn't that friendly. But there are places, if you want to bike recreationally, where that's a much better option. Or if you live in some of the neighborhoods that are closer to campus, that might be a better idea. But going from like Mount Vernon, there's highways that you have to cross and that sort of thing, so it's not necessarily the best option.
I just want to add one thing really quick. I'm not a biker, so disclaimer. But the street which I live on in Charles Village, it's called Guilford Avenue. They just recently made it a bike boulevard, so it's much more friendlier than St. Paul or Charles Street or some of the other busier streets if you do want to bike to campus from there. And I do know many people actually within the M.P.H program who live in different parts of Baltimore who bike. So a lot of people do it. And also, I think that the city is going to be implementing a bike share program soon, so they are trying to, there's a lot of things happening to make Baltimore more bike friendly. So it's definitely on everybody's mind.
I can speak to the drivers of Baltimore. Some of them shouldn't be driving. I will say that, but that's for the East Coast in general. We're just psychos on the East Coast when it comes to driving. But like she said, as long as you assert yourself, most people have common sense and they stay out of the way of bikers. So it's fairly okay to bike. Now some of the hills are kind of crazy, so you'll definitely get your workout in and get into school, but definitely a viable option.
I also just wanted to add, I am not a lifestyle biker, I am a social biker, and if you are wanting to bike for fun, there's a huge bike scene here, and each first Friday of the month, in the, it's actually a lot of the year, it's not the entire year, but there's the Baltimore Bike Party, and you will get literally, 700 bikers, and there's themes, one of the themes was hipsters versus lumberjacks, so everybody dresses up, and then it ends in a big party. There's Union Craft Brewery in Hampton, so people literally bike through the streets, and it's a great way to make friends. And so I think that I can't speak to those safety concerns because I only bike in groups dressed as a lumberjack, but there's a cool scene there in terms of that.
Just a couple more things to add. So in terms of bike lanes, there are a couple if you go down to the harbor and the more touristy areas. I bike to school sometimes and I use the sidewalks even though I'm not supposed to, but no one has told me not to yet. So, and then the other 2 points is that it makes the city a lot smaller when you have a bike. It's really quick to get places because the Charm City Circulator, which is the free bus, it's really great because it's free, but it does huge circles and it makes it really long to get places sometimes. So biking is really good and direct. And then the last point is that Hopkins around campus has a lot of places to park your bike, which is good.
One of which is in the garage of our building, which is on the very bottom. So, and then we need to answer the second part of her question. Does anybody know about costs for one-bedroom apartments?
I'm in a one-bedroom. It's $1,300 a month. I live with someone else, so that makes it affordable. But that's pretty based on the people in my neighborhood. That's fairly typical for a one-bedroom.
I did a lot of house hunting for the place I'm moving into, and I'd say that I wanted like hardwood floors and a fireplace, I'm not gonna lie to you, and I got that and a parking spot for $11.25. And like I've lived in New York and I've lived in other cities and I'm happy with that. I think that like if you want to get a studio, you can do that for like $800 depending on the neighborhood, but I think that like around $1,200 is what I would say.
Okay, next question. The green sweater. Yeah. Are there certain neighborhoods that are known to be more affordable? Speak into the microphone.
I would say Charles Village is generally pretty affordable because, I mean, it's near the Homewood campus, so they understand that, you know, they're catering to student demand. But I would say that the closer you get to the Homewood campus, the more expensive it does get. So if you live a little bit on the outskirts of Charles Village, you might find a better deal. But I think the less traveled, the less popular neighborhoods that you maybe won't hear as much about tend to be cheaper. But you just have to balance that with, do you feel comfortable living there? Do you feel comfortable being away from kind of the main drag of Baltimore?
Sort of quick follow-up to that question. If you live on like the outskirts of Charles Village, is it still possible to buy a Charles spot? Just because like I don't have a car, I won't have a car.
Yeah, definitely. So I live on 27th Street, which is towards the very south end of Charles Village, and the shuttle goes south to get to this campus from the Homewood campus. So it passes by, and there's a stop on 27th Street. So definitely.
Okay, next question. How about over here?
So I see you all live in apartments, right? And I wonder if you guys know any like co-op graduate student houses as an option.
The question is if there are any co-op housing as an option.
So I actually don't live in an apartment. I live in a row home. So I'm sharing with 4 other people, 2 other people who are graduate students, and then the other 2 people are working professionals. So I don't know of any established co-op graduate student houses, but there are a lot of graduate students who live together in houses managed by private landlords.
Next question. Way in the back. The question is, what does the community feel for new students meeting new people, and kind of what life is like here as a student? Not all at once. Take your time.
It's a really social environment. It's really fun. I'm speaking from the perspective of being in that M.P.H program. So my cohort started it all together at the same time, and we were the only ones in the school. So during the summer, we had a lot of social events to get to know each other, and it's kind of continued a little bit into the school year. Even though we're really busy, there are always events. And then within school, when we see each other, it's always really friendly and fun. And I don't know if that's what you're looking for, but I hope that helps.
So I don't know if you were getting at the community feel here or the relationship with the surrounding community in Baltimore. I'll try to speak to both of them. The first is that the people here are great. Like, everybody's obsessed with public health, so you have stuff to talk about. And I would say that that's really cool and enriching, and there's a lot of positives. I also made a really conscious effort to try to build a life and activities outside of Hopkins. I think that it's really easy to get sucked into this place, and the work that we do is like so applied to both the community in Baltimore and the world. And so I would just do another little shout out for Source. I would highly recommend, you are in Baltimore, there's so much work to be done here. Get involved in your community and be a representative for Hopkins in that way. I think that Source is doing really great things, and there's still so much more room to grow. So I don't know, yeah, I think that there's like so much arts and culture and music and a really cool scene both within Hopkins and outside of Hopkins. So yeah, I like it.
This is a great city. Let me just tell you that right now. Okay, let me just get this out the way. How many of you have seen The Wire? just raise it, just raise it. To be honest, just raise your hands. Come on, get it out the way. Okay, it's not that bad. It really, really isn't. That's mostly the West Side anyway. but it's, you know, I understand that a lot of people come in with their perception of Baltimore based on how it's perceived in the media. It's no different than any other major city in the country. They all have their problems. Baltimore has its problems, and once you live here, you can feel free to complain about them too, which I've been doing for 27 years. But being at Hopkins gives you a wonderful opportunity to actually fix some of the problems that the city has. And there are many problems, but that leads to golden opportunities to be part of the solution. And being at Hopkins, it carries a reputation. It's a big name. You guys know that. Don't be naive. If you have Hopkins at the back of your name, people are going to listen to you. But what I will say is they're not trying to hear, pardon my language, the same BS that they've been hearing for the longest time. There has been a strained relationship between Hopkins and the city. But I will say that they are doing their due diligence to try to fix that relationship. And us up here and any students that come in next year or this year, you can be part of fixing that relationship. And the city is welcome to that. The city is very friendly. They are nice people. They will talk to you even if they don't know who you are. So that can be a little jarring and a little shocking, but get used to it. People will say hi and say, how are you doing? So answer them. You know, you know, it will make your day better. It will make your life better. But you have a wonderful opportunity if you come to this school to make a huge difference, not only in your personal life, in your professional life, but in the city. And the city will thank you for it. Trust me, they will thank you for it.
I agree 100% with everything he just said. As I mentioned, I've had a chance to engage with the community a little more on a deeper level since I'm doing a Master of Social Work. So I've been doing community organizing and really getting out there. And I have to say, like, Baltimore is the warmest, most welcoming place I've ever lived, which I wasn't expecting when I moved here. I spent 6 years in Philadelphia before I moved here, so I thought I had a good understanding of what a big East Coast city would look like. But I feel like Baltimore has a small town feel, even though it's a pretty large city, and I think that's really unique. So if you put in the effort to engage with local people who are from Baltimore and really engage with the community, I think you'll find it very rewarding and welcoming. And as to the community within the school, it's a very social environment. There's always events. It's just a matter of how much you can fit into your life and balance it with your schoolwork. And I think within each of the programs, the cohorts become very close throughout the program. The M.P.H program is pretty unique because we do start in the summer, and nobody else is here. And the summer is full of social events, and I think one of the goals of the summer session is to really build those relationships and foster that community feeling. But from what I've gathered, even in the other master's programs and Ph.D. programs here, the cohorts are very close with each other because they do take a lot of the same classes together and spend a lot of time together.
Oh my goodness, you guys said literally everything. I do just want to reiterate that people will greet you on the street, and that is not something that I was used to either, but everybody is just like super friendly, and not just hello, but they want to know how you are, and they want an answer. So.
And the other thing, really quickly, some of you may be concerned. How many of you are gunning for PhDs? Or going for the PhD program, you will get to know your cohort. That is your army, and you will be fighting the battle for the next 4 to 5 years. You're in it together, so you definitely will bond. And it didn't really take that long, but it will take some time. You will get to know your cohort. M.P.Hs too, but definitely PhDs, because I can speak from that perspective. And it's not so competitive. That's the one thing that I came in thinking, okay, everybody is my enemy. We all want the same thing. I gotta scratch, claw, punch, kick to get what I want. No, you can get yours. And not have to worry about making everybody your enemy. You can be friends and still have the same accolades and the same, commendations and stuff like that. You'll get everything that you earn. And that's the thing, you'll earn it. And you can still have friends along the way. So that's the one thing that I really appreciate.
David's so right on, and we're in different departments, and that's, very true of my department as well. Just to the PhDers, nobody asked this, but I just want to put out there when I was making my decision, since it is like a bit more of a time commitment, I was thinking about things like, okay, so I'm not just saying yes to Hopkins, which I could easily do, I'm saying yes to this city where my life will be. And then, quite frankly, the follow-up question was like, well, what if my future husband that doesn't exist yet, doesn't happen to live in Baltimore, for example? It's gonna put a real wrinkle in things. And so I just want to say that, it's true. This is a great city, and if I knew that it was going to be like this, I would have not even like asked that question. It's a great city for like social, academic, dating. Like it is a great city, and so that like put that out of your mind. Like if you're not seeing Baltimore as a strength of the Hopkins program, you're thinking about it all wrong. Like I really believe that.
All right, we have time for maybe 2 or 3 more questions, so make them good. Right here.
I don't know how popular it is for private school, but I'm wondering about families.
Mhm.
You have young kids, what neighborhoods are hopeful for a little balance.
Sure. The question is about kind of life in Baltimore City or the Baltimore area with families and little kids.
I just had my son on Monday evening. I know, newsflash. So I'm going through this as we speak about how this city is going to mold my son. And obviously it's going to be very easy for me to refer to how the city molded me. There are a lot of opportunities and a lot of resources that you can utilize to give a child a very well-rounded education. And I don't just mean book learning. I mean artistic, cultural, athletic. It's all here. It's all here, and I can speak to that because I'm a child of the city, and I can tell you, look what it did for me. I'm talking to you right now, so obviously it has something going for it, and I look forward to presenting those same opportunities for my son because that's what I want for him. So as far as raising a family, well, it's happening, and I think this is a good city to do it in.
If I can just chime in, there you are. I was like, who asked that question? There are a lot of, I know Federal Hill is a popular place. It's where our the director of Source actually lived for several years with her 2 young sons. And once at their school age, that's when you want to decide if you want to look at the city school system or look at county school systems, and that can kind of play with what your areas are. We do have a daycare here. In all honesty, it's a really long wait list. Yeah, but I actually have a lot of experience personally with researching it. I'd be happy to touch base with you offsite. Yeah. Sure. Sure.
So I think one neighborhood is Edgar Gardens.
Okay.
Behind the YMCA on 33rd Street. And
Yes.
there's a lot of medical professionals that live in that neighborhood. It's a diverse neighborhood. It is just off the map.
Where is it?
It's very,
Oh, it's up top. Right around up here.
so YMCA, there's green space, there's Lake Montebello to walk to, and you're walking distance to Homewood Campus.
And that was Ednar Gardens. Yeah.
Other one that not talked about a little bit, but I actually am moving there, is Locust Point.
Oh, yes. That's off the map, too. That's down here.
A little less urban, and Edgar Gardens is a little less urban.
Sure. So those were 2 suggestions, Ednar Gardens and Locust Point, which are kind of they're 2 beautiful areas where there's green space. There's a YMCA, which our former director of admissions used to have her kids in daycare there. So there's a lot of different opportunities for that. All right. The best question, please. I think she looks pretty eager back there, the very last row. Well, we're holding you to it, so. Yeah, sure. The question is for 1-year master's programs. When you're coming here, do you rent furniture? Do you ship furniture in? Do you buy new furniture? What's kind of the plan?
Wow. Okay, where do I start? I got my couches from a friend who was moving to a different state. I got some pieces of furniture from Craigslist. I got some pieces of furniture from the streets.
Wow.
Well, there are a lot of students, and so people cycle through, and when they're done with their furniture, they put it outside, and it's ripe for the picking. And I got my bed from IKEA. Yeah, so it's a very eclectic collection of where I got my furniture, and it helps having roommates because they also contributed some things too. Oh, and I found my dishes in my sister's neighborhood on a curb that someone didn't want anymore.
Oh boy.
Go ahead. Can you bounce back from that one?
knew that I wasn't going back, so I packed up and moved cross country. But I do know people who live in the same neighborhood as me who are able to rent furniture through their apartment, and found that that was more affordable. It actually ends up being about the same price as having to move, but a lot less hassle if you have a place that you are continuing to rent wherever you're coming from. And so for the person that I know who did that, that was a better option. But for me, it was just easier to bring everything with me.
Just really quick, since I'm a dual degree student, I've lived here for 2 years, so my situation is a little different, and I'll be staying here for a few more years afterwards. But I just wanted to mention that there are Facebook groups for the programs that you guys have all applied to, and especially for the M.P.H program, there's a Facebook group that was created, like, I don't even know when. I found out about it really late, but a lot of people post, a lot of the outgoing students will post about furniture and apartments and anything related to living on there. So I would even consider finding it and joining it now so that you can start gathering information and jump on things.
All right, I hate to cut us off, but lunch is waiting. And it is now time to get into your departmental afternoon sessions. Thank you, panelists, for coming. I do have some logistics. Please wait before you guys wrap up. What we're going to be doing is going back to Finestone Hall, where you're going to pick up a boxed lunch, and you're going to take that with you to the room that's noted on your agenda for your specific department. I know a few of you may be admitted to multiple departments or degree programs, so this is your decision which session you want to attend. You can go back and forth if you want, but a lot of the departments have breakout sessions and things like that, so it might be good just to touch base with me if you have any questions about that. Those folks that are going to health policy and management and to mental health departments, they're located down at the Hampton House. We'll have escorts out here in the gallery to meet you, to take you down to the Hampton House. HPM is meeting, Health Policy and Management, is meeting at the Wall of Wonder, which is that big screen right out there, just in that gallery area. And then the Mental Health Department, we're going to be meeting right where you picked up your registration packets this morning. We'll have a student escort to take you down as well. The ending times of your afternoon sessions are going to vary, so that will allow you to come and take advantage of the other things that we're offering. We have the information fair that will be in the gallery right by where you picked up your registration packets. We're offering campus tours that will be leaving from the student lounge, which is just right over here in this area, right around the corner from this lecture hall. If you came to a campus tour previously, one of our Friday afternoon sessions, it's basically the same tour. You're welcome to take it again, but we also have included in your packet a personal walking tour, which takes you through our building, but also takes you through the medical campus and over to the Hampton House as well. It takes about 45 minutes to an hour to complete, so that's for your reference or just for your reading pleasure as well. We are also offering some virtual info sessions. I just wanted to let you know because there's a lot of questions about housing. The director of housing for the East Baltimore Medical Campus will be presenting that info session, so the information and login information is on our admitted student website. And lastly, we know that you're going to have a lot of fun this afternoon, but we will be in this gallery with a little wine, a little beer, a little water, a little soda, a lot of cookies, and some appetizers. So please stop by and join us before you head out for the day. So thank you so much for coming, and we hope you have a great, wonderful rest of the day.